Present.
Devin Allen, Commissioner Precinct 2. Here. Gary Fickes, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Yes.
Thank you. Our invocation today will be delivered by Pastor Sultan Cole from the Cornerstone Baptist Church in Arlington. Thank you so much for coming out. After the invocation, please remain standing for our pledges.
Thank you, Judge Whitley. Shall we pray? Heavenly Father, as we gather together in the esteemed and hallowed chamber of the Tarrant County Commissioner's Court, we praise you for this day and your purpose for it. We ask that you would sanctify all who are here so that your purposes might be fulfilled through each servant leader that you have appointed as servant leaders, namely the Honorable Judge Glenn Whitley, the Honorable Roy Charles Brooks, the Honorable Devin Allen, the Honorable Gary Fickes, and the Honorable J.D. Johnson to serve as commissioners. We pray for your wisdom and your blessings upon them. Your word declares that in your word, for my thoughts are not your thoughts, and your ways are not my ways. This is the Lord's declaration. For as heaven is higher than earth, so my ways are higher than your ways, and my thoughts than your thoughts. Reset our agenda today as we sit in your presence. For you assure us that where two or three are gathered together in your name, you are here. Recalibrate our intentions and refocus our hearts. Your will for our lives does not always reflect our plans. Change them to reflect your will and help us to understand that we don't need full clarity to walk in the unique purposes you've been laid in our lives. We have entered into a new year, and only you know what lies ahead. You are always our unwavering protector and shield, according to Psalms 3:3. Keep the words of King David fresh in our minds and renew our hearts to the future of your truth. I lie down and sleep. I wake again because the Lord sustains me. Let your peace reign upon the affairs of this court, here, the Tarrant County Commissioner's Court, as we seek you more than anything else. It's in Jesus' name I pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America
And to the republic for which it stands, one nation, under God, indivisible, and justice for all. Honor the Texas flag. I pledge allegiance to Texas, one state, under God, one and indivisible. Thank you, Reverend.
Mr. Manius.
Thank you, Your Honor. Members of the Court, several announcements relating to the agenda this morning. In your red folder, you'll have, under the Administrator section, item 7A1. This is the slide presentation that we're about to look at. You have a revised copy of that slide deck. There's one minor correction. Also, under Transportation Services, item 7J1. This is the 2021 Transportation Bond Program Policy. I believe that we did post the corrected one, but we also included in your red folder this morning a copy of the corrected policy with the additions that the court had given us. I believe they're highlighted in yellow. Finally, members of the court, as we go through the agenda, we're going to once again take several things out of order. When we get to the Administrator section, we're going to go ahead and we're going to do the presentation on item number 1 first. UNT Health Science Center is here to do that presentation. Once we complete that presentation, then we will go ahead and ask Mr. Tanasia to come forward and do his health update to the Commissioner's Court. Your Honor, I believe that we have 4 audience participation forms this morning, 3 on the phone and 1 in person. We'll take them after Vinny does his presentation.
Would you check that mic and be sure that that's on?
I do have it on. You can turn it louder if you. I didn't realize you wanted to hear me that clearly this morning.
No, you see, that's why I waited until after you were through before I sit and check and make sure.
I knew there was some strategy at work, so.
It's going to be that kind of day, GK.
Yeah, I know it.
So, members, you have before you the minutes of our regular meeting of January the 12th.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We do, while we don't have any proclamations today, I don't know if any of y'all have any
I do have-
announcements that you want to make?
I do.
Commissioner Allen?
So as many of you know, yesterday was a celebration of the life, work, and sacrifice of Dr. King. And so over the weekend, I had the honor of spending some time with the Precinct 2 community in various recognition events. And I think one thing that's important to mention about Dr. King is he was no doubt a social justice advocate in many ways, including he cared very much and worked on healthcare issues, which I know we have spent almost a year now talking about COVID-19, how to mitigate it, how to best serve our community. And as we are in now, I guess, the 4th week of the vaccine rollout, is seeing that there are some folks in our community that we have to do a better job in reaching. You know, last week, I had shared some specific frustrations that I had with how we were having those discussions and making sure that we were making the decisions with equity in mind. And afterwards, I was met with quite a few questions of well, I don't understand, and what's the big deal? So I'm going to share with you all what I think the big deal is. It won't be in my words. It'll be reading from a speech of Eli Wiesel. He was a social justice leader, a Holocaust survivor, and a Nobel laureate. And in his 1999 speech entitled The Perils of Indifference. What is indifference? Etymologically, the word means no difference, a strange and unnatural state in which the lines blur between light and darkness, dusk and dawn, crime and punishment, cruelty and compassion, good and evil. What are its courses and inescapable consequences? Is it a philosophy? Is there a philosophy of indifference conceivable? Can one possibly view indifference as a virtue? It is necessary at times to practice it simply to keep one's sanity. Live normally. Enjoy a fine meal and a glass of wine, as the world around us experiences harrowing upheavals. Of course, indifference can be tempting. More than that, seductive. It is so much easier to look away from victims. It is so much easier to avoid such rude interruptions to our work, our dreams, our hopes. It is, after all, awkward, troublesome, to be involved in another person's pain and despair. Yet, for the person who is indifferent, his or her neighbors are of no consequence, and therefore their lives are meaningless. Their hidden or even visible anguish is of no interest. Indifference reduces the other to an abstraction. So, in my 2 years now in serving on the court and trying to make sure that I understood what my role is by statute, what my role is by what the community is asking for me to do and what I know needs to be done, one of the things that has become very clear to me is that my role is to ensure that our neighbors aren't reduced to an abstraction because we are indifferent. And so as we continue on with these conversations, even some that will take place today, it's hugely important that we stop and think to ourselves. And this is not just for us up here, it's for any person who is making a decision about how a resource is going to be allocated. Making sure that you're not indifferent about how that occurs. Making sure that you are challenging the status quo. And maybe it means that the status quo is working, but in some instances, the status quo is not working. So I would never dare to compare myself to Dr. King, but I will say that in his pursuit of social justice issues, including healthcare and even the work that Eli Wiesel did, I think that we are all capable of stretching ourselves to ensure that we are thinking of the impact that we have on our county and serving folks in a way that is equitable and that's sustainable. So happy belated MLK Day to all of you all.
Thank you, Commissioner. I would also like to announce that we have an upcoming blood drive. This, as everything has been affected by COVID, this too has been, and this is kind of our big give. This is where we have basically locations all over the county, including our sub-courthouses, as well as juvenile services. So everybody meet in our downtown plaza building. So this is February the 5th, and I would just encourage you to sign up and see if we can't help out the area, North Texas area, with regards to the blood drive. With that, I will.
I have one little thing.
Go ahead.
I'd like to congratulate the South Lake Carroll Dragons on their attempt to win the state championship. The father beat the son. Austin Westlake was coached by Todd Dodge, and South Lake Carroll's coached by Riley Dodge, his son. And they played a great game, but they were just a little too strong for the Dragons. So.
Sounded like the trash talk was coming from the grandchildren.
Yeah.
Toward Granddad, and
I saw that.
I'm sure Granddad will take care of that.
Yeah.
Son had better, a little bit more knowledge of that, probably from that standpoint. And I think that Dodge actually coached up at University of North Texas for a while, didn't he?
Sure did.
And didn't his son actually quarterback up there for a little bit?
Maybe for a little bit.
It wasn't long.
His son was the quarterback in 2006, 5 and 6 when they won state championships, and his son was the All-American quarterback in the United States in 2006.
Yeah.
So.
Well, I can speak for fathers everywhere in saying that the natural order of things did obtain.
They're both great people.
With that, then we'll move on, and you have before you the consent agenda.
Move approval.
Second?
We have a motion to second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Mr. Manius?
Thank you, Honorable Members of the Court. We can go to the Administrator's section at this time and go to item number 1. You might remember that several weeks ago, the issue was raised that we needed an overall strategic plan on how we are going to distribute the COVID-19 vaccines. With the things that are happening in Washington and the information that we're finding out as we go through this process, there's never a better time to have a strategic plan than now. What we have done, we have engaged the UNT Health Science Center to prepare a draft plan for us, and we'd like to go over it with you today to engage in conversations. This was an effort that Commissioner Brooks had championed for the court, and we're ready to make that presentation. Commissioner Brooks, before we get going, do you have anything you'd like to say?
Yes, GK, and thank you, members of the court. I think that we have reached a point in this pandemic where we are on the cusp of great opportunities. The vaccine is becoming more and more available in our jurisdiction and across the state and across the country. And at the same time, the effects of the pandemic in Tarrant County mark us as the epicenter for Texas for the virus. The vaccine is our best hope to get out ahead of the pandemic, to bring it to an end, to get us back to the place where we hopefully in months, maybe a year, no longer have to wear a mask, no longer have to socially distance from our families and from those we love. The challenge is for us as policymakers in Tarrant County to come up with a way to put shots in 2.1 million arms, to put shots in the arm of every resident of Tarrant County. Notice, I did not say every citizen of Tarrant County. I said every resident of Tarrant County. That is the only way that we're going to get past COVID-19. Now, we're 3 weeks into giving shots. And as my colleague, Commissioner Allen, so eloquently put it, we've got some deficiencies in the process. Equity is one of those deficiencies. If we're going to bring the pandemic in Tarrant County to an end, we have to concentrate on every community, every demographic, every age group, every income level, every piece of geography, every neighborhood. We've got to reach out. And I'm reminded that there is a classic difference between equality and equity. Equality is giving everybody the same thing, regardless of need. Equity is giving everybody what they need. Period. Giving everybody what they need, regardless of where they stand in the pecking order. Everybody should be treated with equity. I've said before, and I'll say again, that we will not reach 2.1 million shots in a reactive way, just following the dictates of the federal government and the state government that they issue from time to time in their infinite wisdom. Being reactive is not going to get us to 2.1 million shots in arms. Having a plan is how we're going to get to 2.1 million shots in arms. And this plan has to be comprehensive. I said 2 or 3 weeks ago that we need a vaccination center, if not on every corner, at least in every neighborhood. That should be our goal. And now the governor has given us the responsibility to take care of our neighbors as well as our own citizens. We have to figure out how to do that, while at the same time taking care of those for whom we are directly responsible. It's going to be a delicate balancing act. Our public health department, headed by Mr. Vinny Taneja, has done an outstanding job of getting this vaccination program up and running. But Vinny and his department are drinking from a fire hose. They don't currently have, in my estimation, the bandwidth to plan. They're too busy giving shots, as they should be. So it's a good thing that we have resources in our community, like the University of North Texas Health Science Center, which can be that, in Greek tragedy, they used to call it the deus ex machina, the God from the machine, the one who just kind of got lowered into the midst of a situation and brought about order and corrective action and righted the ship. UNTHSC has always been a great partner with Tarrant County and with Tarrant County Public Health. So I thank Dr. Williams and his team for taking on this assignment to try to get us to 2.1 million shots in arms and to take care of the equity piece so that health in one segment of the community is health everywhere in our community. That is our goal. Mr. Manius.
Before, I want to make a couple of comments on it. We have an update meeting today at 3 o'clock with the folks who are currently given the vaccines. And it was, Arlington was not able to open today because they didn't get their vaccines this particular week. But I want to make sure that, Mike, it may be good for y'all to be a part of that conversation as well. Commissioner Brooke and the other commissioners can be a part. I know we'll have the issue regarding conversation in a quorum, but certainly Commissioner Brooks, with your involvement, maybe the two of us and the rest could listen on. But I think the purpose of that is to, one, get an update as to how everybody's doing with regards to vaccines and where they're giving it. We have 3 hubs in Tarrant County currently. We have the public health, we have THR, and Arlington. And those are ones, but in addition to that, public health is operating out of Resource Connection, out of Bowling, and out of Hurst from that perspective. Over the weekend, I talked a couple of times with Andy Eads, who's the county judge in Denton County. They last week tried the mobile drive-through, and while I was originally very skeptical of that, they have indicated they've had tremendous success. And so I hope that we're going to look at that as a strong possibility. They gave 500 one day, 3,000 the next, and then they're scheduled twice this week to give 3,000. And that's only because all they got was 6,000 vaccines. So vaccines are becoming more and more of an issue. I think, Commissioner Brooks, this may be something that will help with the neighborhoods. Certainly, I think it will help with our reaching out to other counties. As hubs, we're required to open up the registration to anyone in the state of Texas.
Right.
From that standpoint, the big question mark is, as everybody has indicated, is the number of vaccines that come in and when they come in. So that's something that we'll, I'm sure, be discussing this afternoon. There is some conversation that President Trump, I think, has released the 2 million that they had been holding back. Those could be coming in a week. President-elect Biden has indicated that he wants to do 1 million a day for the next 100 days. So there could be, we could be going from a capacity of 40 to a availability of maybe 100,000+ vaccines a week.
And
So
that's why this is the pregnant moment
I agree.
for us to come up with
And
a system.
And I think as we listen to Mike and them talk about that today, timelines are, I mean, like we said, we've been talking about it for 3 weeks. We got to stop talking about it.
Yeah.
That means we got to commit money,
We got
whatever it
to
has to
gear
do.
up quickly. We got to commit money, which we have available. And we got to get this thing up and running immediately.
Great.
Thank you, Judge.
So are we ready for the presentation? Okay, very good. So I'd like to introduce,
No, I'm ready to go.
so I'd like to introduce Dr. Michael Williams with UNT Health Science Centers to begin the presentation.
Good morning, Judge Willie. Good morning, Commissioners.
Morning.
My pleasure to be here with you again. As has already been stated, through Commissioner Brooks' leadership and contact with Mr. Manius, we were on a video call a few days ago to go over the preliminary presentation of this plan, and I will just tell you a little bit about how we went about approaching this plan. So my life as a practicing physician as well as a hospital CEO for a number of years, the way I approached these kinds of problems was starting, it's not rocket science, it's actually pretty simple. Start with the patients in mind. Who are the people that have to receive it? What are the barriers they have to get through to get to it, and or we get to them? And so it's much in line with the comments that have already been shared by Commissioner Allen and Commissioner Brooks and Judge Willie. So we went about this looking at, okay, what are the different populations of patients and how do we get served to them? Because our goal was not to diminish in any way the work that Vinny has been doing, the public health department's doing. It's more about how do we broaden an approach that prepares us for larger supplies of vaccines, which we believe will be coming in the coming weeks and hopefully months, if not weeks. So that's how we started. And so we started looking at, okay, in those populations, there are disparate issues around transportation, around access to internet, around health literacy issues. There are issues with immobility and handicapped status. And so if we look at, there are just a lot of people that just can't go to a particular hub. And I realize that's where you start because that's how you've got to start getting doses out. So as we approach this problem, that's how we started. How do we build a multifaceted program or plan that would help enhance what you're already doing, but approach several populations at the same time when we have enough supply, or in a phased-in approach as we get more supply. So this plan will include things like drive-through. It'll include things like destination hubs, which are already running. It'll include using mobile applications directly into neighborhoods. It'll use multifaceted centers and faith-based organizations and private sector organizations like pharmacies, et cetera. It'll look at even to the point, at some point, I'm not sure when we get there, but at some point it's going to be community workers walking neighborhoods, or some of our population of students walking neighborhoods to get vaccines to those who can't get out of their house or don't have access to internet, or they get an appointment to come get an injection. They only had a ride on the day before that, so they can't get to the injection, so they miss it. So there's a lot of things that we need to do here. So I'll kind of wrap up there to say that the plan we want to present to you is going to take that approach, the approach of the patient with a multifaceted delivery system. That's hopefully it's a high level program. We will still need to come back later and work with you all very quickly to put a resource plan with this, if this is the direction you decide to go, or alternatives of this plan and how we can do that and deliver on it and execute on it. But this is a team effort. This is not the Health Science Center stepping in to be the only ones doing this, but we certainly want to do our part for the county. So that's where we are. I want to start by introducing a key team member of ours that I'm very proud to introduce to you, and I don't think this will be the last time she's before you. In October of last year, I first met Dr. Sylvia Trent Adams, and then was blessed to have her come join our team this past October. And Sylvia has a very strong past that I want to make you aware of, and she'll be giving the actual presentation for us, and then I'll be back up for questions if that'll be appropriate. So Dr. Sylvia Trent Adams currently serves as the Chief Strategy Officer for the Health Science Center. She's a transformative leader, as I said, and I think will be transformative in Tarrant County in the coming years. She served as the Principal Deputy Assistant Secretary for Health from 2019 to 2020. She shared responsibility with Assistant Secretary of Health in HHS at the federal level for planning, coordinating, and directive substantive programs. In 2017, Sylvia was serving as Deputy Surgeon General and was, because of circumstances, asked to step in as Acting Surgeon General for the U.S. Public Health Service. She retired in August of this year at the rank of Rear Admiral of the U.S. Public Health Service Commission Corps. And in her different roles,
Excuse me, Mike. You go, girl.
I got more to tell you, but I'll make it quick. I can't do all this at one time here. She's a rock star. She has not only has this experience at the HHS level. Early in her career, she started off as an Army nurse and left the Army as captain, and then moved to the U.S. Public Health Uniformed Services Corps and began her work in growing into senior leadership roles at HHS. She served for previous internships in 2 U.S. Senate offices and served for the past 3 presidential administrations in Washington. She, above all, the key skill I want this group to understand is that in 2014, she was called upon to lead the West Africa Initiative on Ebola, and she's got experience in delivering mass delivery of therapies and understanding how populations work. And in 2016, also did similar activities around the Zika virus and the U.S. response to that. So I'll stop because this could go on for a while. I'm real proud to have her here at the Health Science Center and proud to present her to you and let her give you the presentation that was developed for this program. Thank you.
Good morning.
Good morning, Judge Whitley, and to the commissioners. I'm so happy to be here with you all today. Thank you for the opportunity to, may I take this down, to present to you on a very important issue that we're facing not only as a nation and the state of Texas, but also in the world. The COVID-19 pandemic has really impacted all of our lives, And I am hoping that we will be able to work together as partners, both at the HSC and across every sector of society here in Tarrant County, to be able to combat and eradicate COVID-19 in Tarrant County. So if I may, I'll go ahead and start the presentation. As Dr. Williams indicated, there are so many things that are happening in the community, and we have an obligation at HSC to make sure that we help to get this on track and to support you in any way we possibly can. So I just want to start out, I'm an academic at heart, so I want to make sure that we cover our objectives today. My first slide here is just to give you an overview of what I will be talking about. I'll spend a few minutes talking about how to expand access to the COVID-19 vaccine in Tarrant County, and to also look at some of the strategies to implement additional sites where they are indicated would have the best penetration of the market with the communities that we serve. And then also identify some models to deliver vaccines in community-based settings, in addition to the hubs that we have already stood up. I want to also echo what Dr. Williams was sharing about the work that's been done by the Public Health Department. Phenomenal effort thus far, and we want to not replace that, but simply supplement that and expand it to increase access to those in our community. Moving on now. So first thing I want to talk about is expanding access in Tarrant County. We can expand the capacity of our current sites simply by adding a mobile component or increasing the hours that we're utilizing those sites at best. Most of the things that we're doing have been proven. There are concepts and models across the country and across the world that show that having individuals come into sites where you're able to directly observe them is a very effective and an efficacious model. However, it does not increase the throughput when you're trying to inoculate 2.1 million people in other models that have been proven to be successful and safe as well. So looking at how we expand those current sites, I think, Judge Whitley, you mentioned that earlier, and that is definitely one of the proposals we would put before you. Next, developing new sites with new partners. The Health Department has done a tremendous job, but now is to bring all our assets to bear to this particular effort, which would mean looking at some of the new partners that may be on the sidelines waiting for the Health Department to reach out to them, or may not have had the capacity when this first started to be able to come into the game. So now is an opportunity to reach out to them and bring them to the forefront. Establishing mobile clinics. I think that for some of our populations are more rural in some of the parts of Tarrant County, there may be individuals who just cannot get to a hub site or don't have transportation, or may be limited due to disabilities just to be in their homes and may not be able to come out to a site at all. So mobile access will provide those options for those individuals. And then eventually, we may get to a place where we're having to provide home-based access for elderly patients, for patients with disabilities who may not have the ability for transportation or to be able to leave their homes safely. Now, opportunities for new sites. As I said, there are public health programs that some are already engaged through the Tarrant County Health Department, but there may be others that are not engaged. As you know, I come from the federal space, so a lot of what I refer to is looking at a comprehensive model. Every asset that we have in the county can be brought to brought to the fight. I'm using my Army terminology here. We need to bring every tool we possibly can to address the need in Tarrant County. For those that are not already engaged, we need to offer them the opportunity to become engaged and to bring every resource that they have to the team. School-based clinics, and I'm going to date myself here because I remember when we had several measles outbreaks in my life, and we saw that there were boosters that were needed for kids. We did a lot of school-based clinics for vaccines, and that model can be done very well. It's a high-volume population, and you can vaccinate both school-age kids, the teachers and staff, as well as the community members by having a mobile clinic in the parking lot and having school-based clinics with school nurses or other personnel to service that entire population within the school system. Faith-based clinics. I cannot echo the importance of making sure that we partner with our faith-based communities, churches, synagogues, mosques, whoever has a faith-based audience and are willing to listen to the need and host us as a vaccine site, I think would be a good partner for us in this effort. Increasing the number of sites in high traffic areas. This is something that we've done a lot at the federal level for different types of vaccines. We do large-scale vaccine clinics every year for flu. That same model can be effectively used for COVID-19. There are different ways, given space, that you can set up your vaccine sites using multiple lanes. I've been in flu clinics where we've had 5 lanes of traffic and then designated parking spaces for people to be observed after they get their vaccines. It increases their throughput, and it also allows you to have personnel there in different locations to provide access for ambulances or EMT services as appropriate. Very few adverse reactions have been observed in the population here in Tarrant County. I think we've had 1 or 2, but it's still important to follow the protocol for observation post-vaccine. So as I said, looking at shopping centers, parking lots, and large entertainment venues, and also work sites. Work sites because there are a lot of people who were out of work, who are just getting back to work. We want to keep them at work. So in order to be able to provide them with access, creating work site locations, either in warehouse areas within the Tarrant County area or in worksite parking lots to provide access for the workers, but also their family members. And then having worksite clinics. As a clinic-based facilities, occupational health clinics within large employers within the community would give the personnel access to vaccines while they're working, decreasing the number of the rate of missing the follow-up appointment, but also decreasing the likelihood that they'd have to take off from work to simply get the vaccine if the hours were not conducive to their work schedule. So those are the opportunities for new sites and expanding current sites. Partnerships and collaborations. I want to talk about some of the healthcare organizations that we could partner with. Now, hospitals, and many hospitals are overwhelmed already, but expanding the capacity for the hospitals, whereby there may be high-risk populations that may be concerned about getting a vaccine in a community setting, simply providing additional resources through volunteers for hospitals to increase their throughput in their clinic sites, but also working with community-based clinics. This would include community health centers, other nonprofit organizations that may have clinic space or may have space for us to set up a clinic. Those are opportunities whereby we could expand that access. In some communities, we have a shortage of having providers in those communities, and EMS and fire and rescue are how they access emergency services. So working with those partners to be able to create smaller clinics for a targeted community would definitely increase access, especially in those lower populated areas. And then ambulatory and outpatient care centers, giving providers who are not a part of the public health space but want to provide the vaccine in their community as a private practitioner or as a group practice. We definitely need to look at those individuals who may want to be a part of our team. Pharmacies, this is something that we did with COVID testing early on. The administration decided, we really need to work on increasing access to COVID testing. So we worked with the large pharmacies, Walmart, Walgreens, CVS, and the like, to provide access to testing in the parking lots. We could also work with them to provide vaccines in the pharmacies themselves, but also in the parking lots of those large venue-based, we call them the big box stores, but Walmarts and CVS, to make sure that people who want to get access to a vaccine, they go to the pharmacy, then they can get their vaccine. I think there's a statistic that was floated around by CDC that the vast majority of this population in the United States visits their doctor once a year, maybe, if they have access, but they will visit a location that has a pharmacy 15 to 30 times per year. So we increase significantly the likelihood that someone will access a vaccine through the pharmacies versus going to a provider under normal circumstances. And then also working with case management organizations. In some communities, case managers go out to homes to do wellness checks. They have a portfolio of patients who may have disabilities, such as developmental disabilities or other conditions where their care is being managed through an organization. They could work with us to identify those hard-to-reach populations, such as those who may be at risk for an opioid overdose or may have mental health conditions or other behavioral health conditions. We need to work with them to make sure that we're providing access to that very niche population as well. The business community. As I said before, I'm just as concerned about health as I am about the economy. I want to make sure that the business community is able to vaccinate their workers, their population to a significant level. But working with them as partners as we expand access is going to be critical for us to be able to make sure we're reaching those goals. And then, I'm a country girl, so I know that industry, factories, and transportation and the farming community are critical for us to maintain access to the resources that we need to maintain our society. So looking at, and I had a conversation with one of our colleagues at HSC about the truck stops. Think about it. How do we get goods and services from point A to point B? And in Texas, we have a lot of truck stops. So looking at the highest levels of traffic and targeting those days of the week or those times of the month where we have more truckers, they will need access to this vaccine. They're going from state to state, potentially carrying that virus from state to state. It's important for us to think about those populations we may often forget. So looking at the trucking industry from a transportation standpoint, farming community, because we want to make sure our farmers are safe and able to produce those goods and services that we need to maintain our economy. And continuing on with our collaborations, looking at civic organizations and faith-based groups, colleges and universities, retired professionals, healthcare professional students, that they can provide vaccinations with supervision, and we could use those to increase our workers who are doing this. Working with the visiting nurses associations and other visiting professionals, such as physical therapy and other health professional categories. Occupational health clinics within industry and businesses, and the Medical Reserve Corps, the MRC, and the CERT, which is every community has CERTs, which is the Community Emergency Response Teams. And we can work with Texas A&M to get the list of those providers in Tarrant County to be able to add them to our portfolio of manpower. Now, I wanted to go back to one comment that was made earlier about working with some of these partners. I think we have important resources available to us, and some of them want to help, they just don't know how to engage. Part of this is going to be educating them about what we're doing, telling them how they can be involved, and then giving them a pathway or a glide path to engage with us to give them tasks associated with meeting our mission. In addition to which, we need to work with these organizations to educate the community. There are huge gaps in health literacy, health education, and also just learning about COVID and the vaccine. So we can work with these partners, train them, and give them frequently asked questions to be able to answer basic questions in the community. And I would strongly recommend that we work with community leaders within their own organizations, because we have a lot of underserved populations that need to hear from their own community leaders, and we need to give them the tools and resources that they need to be able to educate them on the vaccine. Now, how do we do that? Well, we do that by addressing some of the inequities. And moving on to the next slide, I want to talk about some of the equity challenges that we're going to face in distributing the vaccine. There's been some concerns about unequal site distribution. We need to make sure that there are ample sites for the entire county. We need to make sure that provider bias and negative provider experiences are addressed. There are a lot of people in this community who don't trust healthcare institutions. And I'm a nurse by training. I've had numerous patients tell me that they don't like going to the hospital, but they'll allow me to come into their homes to do a home visit because I'm on their territory. And so we need to address those kinds of concerns and meet people where they are, provide those added resources to make sure that we can get everyone the information and education that they need to accept the vaccine. Transportation has been mentioned. We do need to look at other tools and resources to get the vaccine to where people can access them most readily, and expand the hours of operation. You know, most people who work shifts don't work a 9 to 5, and if the clinic closes at 5, we will not ever be able to get them vaccinated in most cases. We need to look at some of the models that we have for flu clinics. I was sharing with Dr. Williams the other day that there were some of our flu clinics in Louisiana, specifically when we had a flu outbreak down there, had a significant growth in the number of pneumonias. We opened the clinic at 6 o'clock in the evening and kept it open until 2 o'clock a.m. because we were trying to reach a specific targeted population of the workforce who were not able to get to the clinic during the daytime. So looking at how we can expand hours to serve those who need it most. And then look at, create a mechanism where we can have locations in my community so that individuals from every commissioner's jurisdiction can have access that they need to be able to gain the vaccine. And then there are some sociological factors, and I've kind of hinted at this. You know, there's some beliefs regarding the safety of the COVID vaccine simply because it's an mRNA. The messenger RNA vaccine is a new type of vaccine. So instead of a traditional vaccine that's being made available, there are a lot of questions. Does this work? Is it safe? How do you know it works if you've never done this before? So we need to be able to equip people with information and provide them with the tools and resources to be able to get additional information if the first line of information or education is not successful in providing them with the background. And then deal with the mistrust of the healthcare delivery system. There are a lot of stories. We have to deal with the social structural racism and discrimination that exists in not only society but in the healthcare environment. It does exist, and we need to deal with it. We need to also meet people where they are around language and culture, and deal with those appropriately marketed services. Are we providing what we say we were going to provide? If we tell people we're going to bring a mobile clinic to their community, and we don't do it, and we tell them that you can't get your vaccine here, you need to go 2 blocks over or 5 blocks over, we're going to develop a level of mistrust. So I think that we need to do what we're going to do, stand behind what we do, and tell them how to access the services that we're going to provide. And then providing linguistically correct messaging. I've worked in a lot of programs where we've developed content and we've had it translated, but the translation was nowhere near what it should have been to meet the needs and answer the questions of the population. So just being very sensitive to those types of needs and those types of barriers. Now, let's get to action. So some of the courses of action will be very straightforward, and we've talked about them already, but I just want to kind of hammer home some of the needs that we need to address. So having state and local leaders provide messaging to the community to address concerns about the safety of the COVID vaccine and make sure everyone has access to the information. And that we communicate these vaccines are safe and they are effective, and they're essential for us to eradicate COVID-19. We need to partner with the local health department to host immunization clinics in a broad range of settings, homes, local-based communities, and also provide low-access neighborhoods and rural areas with the same access that we're providing in the more densely populated areas. And then maximizing telehealth to increase access to information on immunizations and any follow-up that is needed. If someone has an adverse reaction, we need to make sure we follow up with that individual to make sure they feel safe and that they feel that we've carried through on the clinical mission of making sure they're safe and that the vaccine was provided safely as well. Creating drive-through immunization sites, as I mentioned before, we can increase our throughput. We can also offer these in many different sites across the county. Very similar, as I said, to the influenza vaccine sites that we have throughout the country. But specifically in Texas, I think Texas had a great success rate of providing influenza clinics through mobile applications. Providing immunizations at more retail pharmacies, having all the pharmacies who want to be involved simply register with the county and be distributed the vaccine as appropriate based on the target populations and what they feel they could have the bandwidth for. And then targeting underserved communities to provide targeted outreach and access. I cannot emphasize the importance of reaching underserved communities, those of poor, underrepresented minority groups, and also rural communities or less densely populated areas. They have less access to information, and some people, as Dr. Williams said, they don't have access to the internet. So where do they go to get information? We need to provide some information either in print or having calls or having a call center accessible to them so they can get their questions answered, and also find out how to register to get access to the vaccine. And then decreasing the barriers to care. Transportation is one of them, being the mobility, being able to leave their home, and also, fear and mistrust of the medical establishment. We need to be able to address that. And then, as I mentioned, establishing a call center to provide vaccine information. So that is the end of my presentation. I hope that if you have any questions, we are positioned to answer those for you today. Thank you again, Judge Whitley and commissioners, for allowing us to provide this information to you today. Look forward to working with you.
I've got a few questions. I think you have really been very thorough in, step on back up, in what you said here, and I'm very impressed with the way you've laid out the presentation. The quandary that I think we're going to face as we go through is twofold. One, how many vaccines do we have? And two, then once we know, how quickly can we ramp up based upon, this week we have 40,000 new first shots. Next week we have 120,000 first shots. Do they get here on Monday or do they get here on Thursday? And then, but once we've got the vaccines, then also how do we prioritize from the major hubs to the neighborhoods to the other surrounding counties? And do you envision, as a part of this plan, how do you envision setting up, I guess, or doing that prioritization and site location in preparation of what may or may not be a significant increase in not only first shot vaccines, but also the second shot, which basically says after 3 weeks you start doubling or tripling what we may have or what we may need to be giving out?
Judge Whitley, that's an excellent question. I think that's part of the planning process, and we would start with the data. We want to make evidence-based decisions around this, and so looking at how many cases by zip code have been reported, and also looking at what is the demand for the second vaccines in all the jurisdictions. And then working with the state to figure out what is the ETA of vaccines, because I think that there's a clock is being developed on how they're going to roll out. We will also have a lot of benefit when the Johnson & Johnson vaccine comes online. So looking at not the short term, but what's the long game here? You know, and I know my husband's a golfer, so he's always focused on the short game. But I mean, we need the short game and the long game. And I say it with all intent that we not lose sight of the ultimate goal, which is to get everyone vaccinated. So where do we start? We start with the 2.1 million. How many have already been vaccinated?
And I want to stop you for just 1 second, because several times during the presentation you referred to Tarrant County or to 2.1. We've expanded out to at least 10 surrounding counties.
Okay.
And so we're probably not looking at 2.1. We're probably very easily looking at 3+ million folks. And to ignore them, or for them not to hear them included in our numbers, will cause them to very quickly begin going to the state and saying, these folks they're not even talking about us. And I know you were charged with looking at Tarrant County, but we're getting Denton County's getting 6,000 this week. We're getting somewhere in the neighborhood of 30,000+. And at the moment we stop including those other ones, we could find ourselves getting 6,000 to 10,000 versus 30, because the state is very focused on getting it out to some of the smaller rural counties from that perspective. So I think in everything we do, we've got to say, okay, this is what we're going to do for Tarrant County, but there's got to be entered into that mix and some recognition that it's also going out and what are we doing in each one of the rural counties from a prioritization standpoint, and all the things which you covered as you were going through that.
I would totally agree with you, sir. I think that the important thing is for us to define our universe. If there are 10 counties or there are 20 counties, we start to factor them into our planning efforts. And from that, we start to develop what method is going to work best in that community. What resources do they have? Resource planning. And I think Dr. Williams is going to answer some of those questions around resource planning and allocation. And then how do we work with all of the pieces of the puzzle around manpower, what's the bandwidth, what are the current public health resources, what are the healthcare resources in general, and then what are the hospital capacity. And some of these rural hospitals are very small and they don't have capacity, or they don't even have a hospital at all. Then we need to start looking at the faith-based communities. We start to look at the civic organizations. We start working with those partners to give us access to a facility, volunteers to do traffic control and those kinds of things. We bring the healthcare manpower through networks of providers to be assigned to a particular mission or task for that particular day and time.
Do you see in your plan, in your preparation, in your implementation more than anything, a site location team that might go into Erath County? Well, Erath County has a hospital. Let's say Monte County, which maybe has 10,000 people. They may have a big parking lot someplace to do a mobile, but as part of what y'all are eventually going to anticipate is that you will visit neighborhoods as well as other counties and say, here's the best way we feel we can deliver the vaccines in this particular area. Is that part of what you're planning on doing?
So Judge, I think our goal would be for the next several weeks to do two key things. One would be to utilize some of the connections you all have with those counties and how we access them for a resource list and establish some partnership lists. And because now's the time right now, while the volume of distribution of vaccines coming in the pipeline is lower, the 20 to 30,000 you mentioned, to establish those partnerships with those people in those counties who are willing to work with us, and then overlay what resources they have, personnel resources to administer, or in other words, it's basically a gap analysis, and it's county by county.
And hear me when I say that we got 30,000 this week. We're supposed to get 30,000. Where's Vinny? Raise your hand. There he is. We're supposed to get 30,000 first shot vaccines, but in addition to that, we may very well have coming, and these are coming straight out of CDC, another 30,000. So we may actually be at 60 right now, where right now the capabilities of our various locations are somewhere north of 40,000, but not much. And so that's why, you know, you say several weeks. I'm concerned that if we don't have something set up in 2 weeks, we're going to find ourselves with 120 to 180,000 vaccines with the capability of only pushing out maybe 60.
Yeah, no, my point is strictly, regardless of the vaccine supply, is to right now get those partnerships elucidated and laid out and nailed down, and then understand what's the resource map that can go over the top of that. In other words, what volunteer fire do they have? What do they have in whatever healthcare distributors?
And I will tell you, the county judges are calling me right now saying, just tell me how many, we provide the volunteers, we can provide a location, just tell me who's going to tell me what we need to be doing.
Right, and that's where we're headed to get to. We got to get the plan approved. How we execute on the plan, to me, is the next step. We got to understand where our gaps are. And
What is the age limit right now on who gets it? You mentioned school-based clinics, and because
Well,
I thought 16 and 18 right now
You
will
know,
work.
it seems relatively, I guess my words would be, it's kind of floating all over the place. I mean, we hear standards set for 65 and older, and then we hear people in their 30s getting them, you know, because I think there's situations where people are getting them in their physician offices, people are getting them in other situations where they're called out to another place to get it.
I was more referring to, she mentioned children.
school-based?
Is it 16 or 18? I think it's 16 for Moderna and 18 for Pfizer.
Right.
I don't know if we know.
We don't know data.
I don't know.
No,
We don't know.
I'm just
J&J
talking about
yet.
if they were giving them to kids. Right now, they're not supposed to be giving them to anybody unless they have pre-existing conditions.
Right.
But if they were wide open and could give them to anybody right now, I think the age limit is 16 and 18, depending on which one
That's
you're
right,
at.
and we don't know J&J.
Now, I've got a couple more. Let me finish mine, and there'll be a host of others. Just as a note, I really liked your idea on the truck stops. And remember, we've got an intermodal yard just north of us that thousands and thousands of trucks are going out probably every day, not just every week from that standpoint. We talked about the distributions. I think that's it. That's all I have. Commissioner
I
Pickens?
just wanted to say, you know, this is I like what you presented a lot. I think implementing this, it doesn't get implemented in a day or two, but it's gonna take months to get everybody vaccinated. But I think we need to identify what we might consider the low-hanging fruit that we can go after. And I don't know, I know we have discussed here utilizing our JPS clinics. I don't know whether that's feasible. I was told that maybe it isn't, but maybe it is, and maybe that's the direction we go. I think the manpower issue is a bigger issue than the facilities issue. I think getting the people that can manage it.
Commissioner, I will say that JPS is averaging more than 1,000 a day right now, and they're doing that primarily through their clinics, through a few of their clinics, and they're going to try to keep opening that up. But this past week, they probably averaged over 1,000 a day.
Well, I would think that would be could be a big part of our solution. As you mentioned, Doctor, the faith-based facilities that are out there. I mean, I'm getting emails now from my church, my Rotary Club, to go online to bealocalhero.com.org. Be a local hero to go help. So it's started. We're fixing to be. I think we may have the people, but we're going to have to train them. So.
But Commissioner Fickes, thanks for your comments. I mean, I think one thing I would say, in addition to the JPS clinic thing, is obviously they've got other day-to-day work they got to carry out, but what we can see is an opportunity to look for locations that are close to those clinics, if those clinics can't offload some things, because people are used to going to that area for their health care. So that's number one. Number two, in terms of personnel, yeah, the personnel is going to be the key issue. However, there are people who would not normally be giving vaccinations that we would enlist and train to do this. I think, you're already seeing success with other places that are using, for example, firefighters who may not be participating in an EMS program, but they've been trained to do this task. And then, you can have the healthcare personnel at a less lower level at some of those sites just for the monitoring of the 15 minutes afterwards. So, and as Dr. Trent Adams said, having access for EMS if something happens.
I think part of the meeting this afternoon with the folks who are currently putting the shots in the arms will be to determine whether or not they feel like they have additional capacity, or if, how much is going to have to be done by new locations, new approaches, whether it be mobile or whether it be indoor type stuff, or whether it be neighborhood, or the idea of having to eventually get to the point to where you're going to their home to give them the shot because they're so frail they can't get out.
Well,
I love that idea.
And there's another part of this we're not talking about. I know Commissioner Brooks and we've had a conversation about it, and we talked about it on our virtual call the other day, and that is the communication program of getting the word out, both inbound and outbound, of how we make sure people know where they need to be. So that's, especially as we broaden and scale this up, that's going to be a very important part, and that effort has to be able to scale as well. So.
I don't have a question for you all. I appreciate what you presented. Honestly, a lot of this we have been hearing from Vinny over the number of weeks, and I understand that it's a capacity issue. I look forward to you all supplementing the efforts and us growing our capacity. Question for you, Judge, is that 10-county region, I've heard you list them off, but I don't know if we formalize that list in any way. Do we need to do that? I can't tell you what those 10 counties are, so.
Certainly we can formalize it. I reached out to the various county judges. Again, NIMKID had asked, for us to reach out, and those were the 10. Do you want me to give you the list? I mean, we'll print something out and I'll send that out to you. But please understand, I mentioned 10, I've talked with 10. It may be well worth having another conversation with the 10 county judges and y'all having an opportunity to be a part of that. But right now, as I understand it, because we are a hub, anybody in the state of Texas could come on and register on our website. We have the ability to pull down, and they're going to tell us what county they live in. Is our database at the point now to where we can pull out everybody from Erath County and send it to Erath County if they wanted it?
Yes, sir, it's happening right now as we speak, but I have it in the presentation to show you all.
So, yeah, right now we kind of take in from the south, we take Ellis and Johnson, Somerville, Hood, Erath, then Palo Pinto, Parker, Montague, Wise, and Cook. Now, Denton may very well be able to help and take care of Cook and Wise and that. Again, right thus far, Denton has done nothing but the drive-through.
Ellis, Johnson, Somerville, Erath, Wise, Cook, Palo Pinto,
Hood.
Okay.
Is that 10?
No, Grayson.
3, 4, 5, 6.
We haven't got Grayson right now.
Haven't got Grayson.
Yeah.
Okay.
Judge, if I can make a comment on what you just said, I think, like Denton only doing the drive-through, I think we start with the ones that get the most mass, and we begin building out the rest of the plan.
I agree.
There's no way you launch all this at once, but it's got to be a staged then plan with resources that can match it.
And that's what we need to see. We talked about that, and that's the reason the governor went to the hub, the big mega hubs, but you're right, we've eventually, quickly, for equity, we have got to get it to the point to where once we've got the places, and then again, it's a matter of if next week 10,000 more vaccines come in, do we give them all to the hubs? Do we give some of them to the mobiles? Do we put some of them in the neighborhood? And those are the kind of suggestions and recommendations we need to hear from you so we make a decision.
I think where we can make some more educated opinions or input about how we can help is as we get more of this data. So populations, gaps, resource availability, working through a communication plan, those kinds of things. I mean, it's a very comprehensive approach to how we attack the problem.
Okay, so I do have a question for GK, and somewhat to your point about kind of what's next. So what's next with this partnership?
So, several things. First of all, we're going to ask you to authorize us to enter into an interlocal agreement with UNT Health Science Center so that we can begin the discussion of what type of resources are necessary, how do we approach this. As you can tell, it is a huge thing that we need to approach. So we need to have guidance, and that means that we have to have a formal relationship with UNT. We're also going to have to start, and I really believe, and I'll defer to the experts on this, we're going to take this thing and this plan and really pull it apart and fill in what it means by doing businesses or doing pharmacies. I think the one thing that we fail to realize is that we can tell you that so far that between JPS and the county and our operations, we've given 60,000 shots in about a 3-week period, and that's a good number, okay? But we're not the only ones that are giving shots, you know, and if anyone expects a governmental entity to be the only vaccinator out there, then we're never going to make this. So engaging those partners, if you will, that already have experience in doing that. The pharmacies are a good example. If the pharmacies had more vaccine right now, they could double, triple, quadruple the amount of vaccines they give and never skip a beat. I've talked to my pharmacist, and that's what they tell me, you know? And so we need to go ahead and do those type of things. The one thing that I have a concern about, one of several, is that how do we manage this, and how do we get input from all the different various groups, either advisory groups to make sure that we're hitting the communities of need that we need to be focusing on, and then how we as a group move this whole process forward. And that's something that we need to really think out. We need to talk a little bit more with UNT to understand how we strategically direct this program.
I would like to see us go ahead and adopt the interlocal agreement. One of the keys to success of this program is going to be having a unified chain of command.
Absolutely.
So that everybody knows who's responsible. And we can plug in partner agencies under this unified chain of command. It's also going to be extremely important that we act with urgency. We need to start standing this thing up right now.
And I would hope that while you're in the process of drafting the interlocal agreement, I mean, I would like to authorize them to move forward on the drive-through, the mobiles, whatever the bigger things are, knowing that later on, you're going to come with us with a pharmacy element or with a provider element or with a faith-based element. But on those bigger elements, I mean, again, I don't want to wake up in 2 weeks and have 100,000 vaccines here, and we don't have the capability of getting them out.
And that's a very likely scenario.
I agree. So, I mean, I would like for y'all to move forward on reaching out to what I would consider to be whether it be mobile, whether it be working with the county judges in some of these outlying counties, or some of the bigger faith-based. The mobiles, I think, can go anywhere. I think it can go into a neighborhood. It can go anywhere. But I think we're going to hear today, as we talk to the ones that are currently doing it, that we'll hear what they feel like their limits are.
So I will tell you that several things. First of all, we're scheduled to go to Denton just simply to look through their drive-through. Public Health is modeling a drive-through process, and if we can scale that up, that would be great. And we've authorized Public Health to engage at least 100 to 150 more employees that can help us. I don't think that's going to be enough. We're contracting. Setting up these sites, they're critically important. They really are. Having the manpower and the resources to actually run the sites is something that we cannot just simply say, yeah, we'll have the people to do that, because we don't have the people to set up multiple sites. We have some resources. We're trying to focus them on areas that they can be the most effective, but we're trying very desperately to gain more and more resources. That's some of the conversation we want to have with UNT, because they can very easily may be able to spot resources that we had not thought about.
And GK, I think that'll work. I mean, I think you're dead on as far as Tarrant County goes, but I'm going to tell you, I think that in the counties surrounding, they would tell you, we'll have all the volunteers and we'll have all the staff you need. You just tell us who you need, what their qualifications need to be, and then what we're going to have is the people to go out that supervises or over, who has responsibility for the vaccines. Because when Vinny and I talk, that's the thing he always says is somebody's got to watch that vaccine. And I think that's why I'm saying maybe the first priority is to at least meet with some of those judges and see which ones are willing to say, we'll take care of everything, just tell us what everything is.
Well, and it's what the folks from UNT have said. You've got to understand what resources we have and what resources we need. The part of what resources we need is the conversation that you're talking about.
Yeah, and I'm just saying, go forth and we'll get you an agreement, and there's trust there, but we'll get you. I mean, I don't want to be here 2 weeks from now saying, well, is the interlocal agreement done yet?
I would like to see us adopt an interlocal agreement, tell them to go ahead and start doing the things that need to be done to put this thing in place. I want to see us allocate. We don't know what the cost is going to be at this point, but I'd like to see us set aside $20 million
Let's just think, I mean, I don't.
for this program.
If your proposal comes back in at 20 million, we're going to have a problem.
We'll come back at 19.
I don't think 20 million is going to cover it.
Well, here's where I think
that'll get us started.
in listening to the state and in talking with them, I think where we're ultimately going to be on this deal is where the CARES Act was, we'll give you the money and you tell us how you spend it later. I think this is going to be, you spend the money and then we'll reimburse you later. So hopefully that, but I agree with what you're saying, Commissioner Brooks. We got the money.
Yeah.
Let's get it done.
And let's not put them in a position of having to spend dollars that are not in their budget to get this thing done. We've got the money.
Oh, hell, they got more money than we do. I've been on their board of regents too, remember that.
So I think I heard a motion and a second, right?
You've got a motion to second.
To move forward with the development of the interlocal agreement and begin working with UNT.
Well, and for them to get after it.
That's,
Yeah,
I just want to be sure the get after it is in there.
get after it is in there.
I think that's understood.
Y'all know what we're asking you to do?
I don't want them to have to wait for their money. We've got money. Y'all go ahead and do what's necessary, and we'll pay you, what's the word? Co-terminus with the event, with the spending?
I'll have to look at
You give us invoices and we'll pay you.
There you
Oh,
go.
okay, we'll work all that part out.
I was trying to help you out, GK.
Because
You need to help those two
this
out.
is not in their budget.
Well, again,
No, we understand.
I think we're all on the same page. Do you
We're
have,
from a premise of trust. So-
that's right. Do you have a clear understanding of what we're wanting you to do?
I'll tell you after
I
long.
think I have a clear picture. Well, it's a muddy one, but it's getting better.
And so, at least until we have a,
I understand what you're asking them to do. And
GK
we'll-
and I can communicate on this, we can work through this, we can bring you something back. And in the meantime, Dr. Trent Adams and I will get to work to understanding, but it is important, in fact, in all seriousness, to get with county judges in these other counties.
And here's the only thing about what you just said is I want to be sure that when you said you and GK will get together and bring something back, that in between then and
Oh, yeah, we're not.
you're going to actually be doing everything you said you want to do.
It's exactly this experience we got involved in early on with the testing. I mean, it's like, we had a point in time where, we needed to set up some testing. We set up the first drive-through testing for first responders. Then later, we set up the one in South Fort Worth. The point is, you got to start doing things. The point is, but in this situation, we want to be thoughtful about what we just start doing because we could sure waste some resources real fast.
But you understand
so
the
we understand
concept
clearly. Sorry.
of we need this yesterday.
Oh, absolutely.
All right.
And you'll tell me, I can have a meeting with the 10 judges set up tomorrow or Thursday or Friday. When you just tell me, and I'll set that up, and you can be on the line with all 10 of those judges, and they'll be all glad to tell you what they're.
So we'll put together a standardized set of questions that they all need to be able to ready to understand, because we need to get that to them first.
Okay.
And then let them be prepared to answer those clearly.
So I'll have that this afternoon.
You'll have it tomorrow morning.
Good. Thank you.
Dr.
You've
Williams,
heard me.
thank you very much for this presentation, and also I would like to thank Danny Jensen for giving me a call up front, giving me a little insight on what y'all are doing. So thank you very much.
Thank you, Commissioner Johnson.
Yes, sir.
Thanks to all of you.
Thank you.
Obviously, we'll be in touch. So we have a motion and a second, but no vote.
Any further discussion? Is Lisa asking a question, or is she telling you about something that's fixing to happen later on?
Later on.
Commissioner Johnson?
Yes,
Motion passes unanimously. I hope y'all got that. Probably should ask you to read that motion back to me, but I don't want to hear it right now. Good.
We'll provide you the information.
They got it.
Okay, so
Can I see Hyder and Troy sitting back here on the wall. Is there anything that we could get them through and get them out of here? Because
I don't think elections has anything.
Yeah,
so you just here to take heat for Vinny today?
it's under purchasing.
I told him he could go up and see.
We have one item on purchasing that deals with the elections or the poll books.
Yeah, come on down, Melissa.
And that's just the payment of an invoice, isn't that correct?
So you guys didn't pay it on time?
We're asking the court
You can
to,
take it off if you want to.
okay. We're asking the court to approve an invoice payment for RFP number 2018-070 for the electronic poll book support and maintenance for Elections Administration to 10X Software Solutions in the amount of $67,500.
Commissioner Brooks is out. Do I need to change that?
Not yet. You need to second it first.
Second.
second,
We have a motion and a second. Any discussion? Please vote. Motion passes. Commissioner Johnson?
yes,
Motion passes 4
Yes.
unanimously.
Thank you.
See you guys later.
Okay, so we're going to go ahead. Are we ready to move on with item number, actually the presentation, the briefing presentation from Mr. Tanasia?
Yes,
Okay.
especially since Hyder just left him here by himself.
There goes my best laid plans of having him come up. Well, good morning, and thank you all. And I want to thank, I know they've left the room, but Dr. Williams and Dr. Trent Adams for sort of crystallizing what we've been talking on and off for several weeks now. So it kind of helps to have it all in a nice package presentation, so y'all can kind of see what a daunting task it is, but it is doable, right? What it
Yes.
needs is a convener, which I'm assuming you've now tasked UNT Health Sciences to be the convener, to bring all parties involved to the table and lay down their chips. What do you have? What can you do? Because as Mr. Mania said, one entity can't do it all. We all have to do it all. So it's really going to take the entire community to work together to get everybody immunized. So that's, again, no surprises here. I don't think we've all heard this. We've all talked about this.
Well,
Okay.
thank you for your willingness to play.
Oh, of course, of course. And I was joking with them. It's like, all right, we're playing off the same playbook, but okay, let's get it nicely packaged, get everybody to agree this is the path we're going to move forward. Let's go.
Before you move on, Benny, actually, I had something for GK, but he stepped away. But I don't want to forget to ask this, is if I've got literally a running list of churches and all that, folks that want to be a part of the plan, what do I do with that right now?
So partners, so share now with Public Health and UNT Health Science Center.
Okay.
But just general volunteers, then they go register at the bealoocalhealer.org.
Okay.
So that's general public folks, retired folks or others who are willing to just participate.
Okay.
Because again, it's a healthcare effort. We want to make sure they have the training and they have the background checks that are needed.
Okay.
But organizations usually are able to give us something for their entire organization. Like we stood up a site in the Northeast. A lot of those cities were able to give us an HR letter that these folks have been background checked. We did training on site and then we can move forward.
Very good. Okay, thank you.
Thank you. All right, so just quick updates. As you know, things aren't looking any better. Things aren't slowing down from a COVID outbreak standpoint. We're now at 197,000 plus cases in Tarrant County and 1,904 deaths. So the death data is certainly spiking as we've seen the spike of cases continue. So our deaths starting to rise up as well. Hospitalization uptrend is not slowing down either. There's been some plateaus here and there. But overall, we're still, I think the pandemic peak right now, 1,474 people in Tarrant County hospitals that are confirmed COVID-related cases. And then from a percentage standpoint, that's 31.7% of our capacity. But as you see, the percentages sort of float up and down. It's really based on how many staff beds they can bring online on certain days. So they're really trying in our hospitals to stay ahead of it and not totally just be, overburdened by the weight of COVID. But the numbers are certainly very, very high in our community. 296 in the ICU, which is about 55% of ICU capacity. And again, 10 staffed ICU beds remain. Like I have said, they've tried real hard to stay ahead of that, and they have tried really hard to triage people so that they can keep ICU beds open. But that in itself is something that we shouldn't have to deal with. So the reality is here that they're having to triage real hard. Whether we go to 0 beds or not, the point is that they're having to figure out who is more critical than the other. And that is a very hard moral, ethical dilemma for healthcare people with long-term mental health impacts on their ability to continue to do the job. TSAE per DSHS is at about 24%, but they're at a pandemic high of 3,919 people. So same thing in our 19-county region. They have triaged real hard. They've prioritized people that need to be in the hospital, added capacity to the hospital beds. So, the percentage might look better because we had 27.7% just a couple of weeks ago or a week ago. But overall, the numbers have actually risen, not come down from a COVID standpoint. And then 72 ICU beds remain in the 19-county region. So trends in Tarrant County, and like I said, nothing's really slowing down here. Things are actually accelerating. And as if that wasn't bad news enough, you probably saw on the news that in Dallas last week, they found the variant that was in the UK. So I'm assuming it's circulating in Tarrant County as well because, we're so combined with each other as a metroplex that people go back and forth every day. We haven't found one in our data, but that's just, because we haven't found one. It's definitely here. And again, like I explained, the death numbers are spiking. We are seeing new peaks on the death data, which is on the right as well. I put all of this on one chart because my presentation was going to be long otherwise. But as you can see, we're catching just a little bit of a break. I'm trying to stay optimistic that our positivity rate is starting to come down from 30%. We're at 24%. Okay, we'll take it, but that's still 1 in 4 people coming back positive. That's a very high positivity rate for our community. And it's not like we're not doing enough testing. We're doing ample testing. As you can see, cases are being added every day. It's just there's too much disease activity out there in our community. COVID-like illness is coming down a little bit, so that's good news. And then the bed capacity, of course, is improving, so that's good news. What is not good here is the case rate. So all of those things have other factors that lead the numbers to look better, but the case rate doesn't lie at all. Case rate is climbing, just very sky high, 906 per 100,000 people. That is 9 times the threshold set by the federal government that you're in the red zone. So certainly, we're in a world of hurt in Tarrant County. So what can we do as a community? And I bring this slide up every week. Sound like a broken record, but this is the way out of this pandemic. When you're eligible, get vaccinated. Don't miss your appointments because there's already too many people in line. And if you miss your appointment, it's hard for us to continue to accommodate folks that can't make it there. So the first stop is, if your number's up, go get the vaccine. Sure shot way to protect yourself. And other things should not be forgotten. It is normal that we're tired of doing those other measures, and we think the vaccine is going to just save us. Yes, it's a very powerful tool, but we still need to continue as a community to wear a mask, stay 6 feet from others, avoid crowds, and wash your hands often. Viruses have a way to mutate. And when they circulate at high levels, we're giving them opportunity to mutate. So as if the bad news was not enough, now LA County has identified an LA variant, which, again, we've seen these things happen before. We just want to make sure that we put a curb on that outbreak because we're going to let this get ahead of ourselves, and we need to slow this thing down because more it replicates, more opportunity for mutations. Less it replicates, less opportunity for mutations. So that's how this works. So we need to get it under control as a community and do our part to put the numbers down. So vaccination efforts, and this is going to be a lot of interest, like you all have had in the last few weeks, but the community interest also remains very high. Over 350,000 people have registered with us, on our portal. 290,000 are currently eligible under 1A or 1B, and mostly it is 1B. So 85%, and that number has held true from when we started. 45,000 doses administered by public health and our partners, and over 22,000 just in the last week. And DSHS dashboard shows 67,000 doses administered for the county, but I know that data is lagging by several weeks. But good news is that we're starting to get some of that data, so I was able to build my presentation on a more holistic picture for the county than just what we were able to do. So I'll share some of that with you over the next few slides. So where is the progress? What have we been able to do so far? So one of the challenges we identified was language barriers in our registration process. And so we've been able to get that translated into Vietnamese. It's been working on our website just fine. I'm sorry, on Spanish. Vietnamese is still being worked on. The translation's done. We had technical issues getting that on the website with the fonts not being available for our database software. So we're working on a solution. So Spanish is up and English is up. Vietnamese being worked on. Video FAQs, those have been released in all 3 languages. So if any of you all subscribed to the Tarrant County YouTube channel, you will get an alert, and you'll slowly start to see those posts go on Twitter and Facebook and all these other social media channels where video can be seen. But also, plan is to have them in a loop at all of our vaccination sites. I think we talked about that. Now that this is done, we're trying to get them in a loop and get out to all the sites. At least a couple of them I know have already video monitors that can do this work. So we will try to do that this week to make sure they're playing as people are going through their vaccination process. Partnerships have been forged. THR has come up as a strong partner with a lot of capacity. JPS is coming on, and they're bringing a lot of resources to help us. MedStar has been doing a great job, not only just at our vaccination sites, but they've been able to, we talked about mobile vaccination efforts, and I'll tell you that we piloted that with MedStar, and we took some vaccine to the Stop 6 area. Only 50 or so names on the list just to pilot out the process. 41 people showed up. They've done a good job on trying to pilot this process and give us feedback on what will work, what won't work. And we're taking that information and we're engaging other partners. We've talked to THR, we've talked to Baylor, and a few others to let them sort of see how this can be done. And again, it follows what you all just saw on the presentation. We're continuing to do that work, and once it gets sort of solidified as a master plan, it will all fall into place. But we're not slowing down on engaging these partners and letting them know where the needs are. And then, of course, JPS has really stepped up in a big way in addressing homeless shelters in our community. They work with them all the time on a variety of other homeless shelter needs. So that's been a big help. Again, no one entity can do it all. We're getting the help from all our partners to get the work done. Outreach efforts have been increasing. As you know, the vaccine came very fast, and then suddenly it was, okay, you are supposed to do 1A, which had a different plan, and then 1B opened, which brought up like a lot of community members who needed the vaccine. So the needs changed, and the outreach needed to be brought up. So we've done a few virtual town halls and a few more planned. We've ramped up our social media messaging. We've ramped up our word of mouth messaging, and we're working, through our PIOs. So we have the county and the public health PIO working with City of Arlington and City of Fort Worth PIO to come up with sort of a master plan on communication and messaging. And that's been led by Mr. Manius's office. So we'll, work with them on how to roll out the county-wide effort on getting the messaging out. Again, those folks who currently are signing up, they are getting the message, certainly, but there's more need for the general public to understand what is happening, when is it their turn, and so forth. But one thing that's coming out real well, and I'm encouraging all partners to start working with us on this, is to let us be the central registry, because we have been able to successfully give this information to THR. Just to throw a number out, we've given them 2 buckets. First bucket was 7,000 people, second bucket was 8,000 people. What I know from looking at the data just a couple of days ago, that we have information back on about 4,000 people that they've been able to do out of those, but they're working on scheduling a lot of these other appointments as well.
I want to add, Benny, to that point about THR, is that a constituent of mine had shared that they received an appointment through THR, but it didn't specify the time, like whether it was AM or PM, and they weren't able to reach someone to confirm. So what was assumed maybe was a 7 a.m. appointment was actually 7 p.m., so they had to go twice. So I don't know if that has since been corrected, but that's something that we definitely can't afford to continue to happen. So.
I will pass that along. I hadn't heard, I know I heard something yesterday. There was some confusion about whether it was a holiday or not, and people were at a location. It was, somewhere we would technically be, and so people thought it was us. It wasn't us, so we'll make sure that they're getting that feedback as well. Okay. Everybody's kind of trying to wrap up, and of course there's going to be some challenges. Okay. And of course we're open to neighboring counties, and those folks are registering, and some are already getting appointments, but some are sort of later in the queue. So let me kind of show you what we've been able to do. We urge everybody to have a little patience, because it's not just standing up of resources, it's also availability of vaccine is very limited. But as you can see, we've worked through most of the big push that we had early on. December 30th was a big day. We had, I think, 44,000 people registered after we deduplicated people registering multiple times and taking out who were not eligible. We had about 34,000, I think, 34,000 and some change. And all in all, we've gone all through all of that. Those people in the green have had appointments, and we're working on January 1st, which is, sounds like it's very far away, but we've worked through several thousand people in just a short 3 weeks. And as you can see, the green data shows up all the way almost to the end, and that is because there are some people in the 1A category that register on later dates, but that category moves real fast because there's a limited number of people there, so they're getting appointments, but we're getting a lot of 1B appointments through us, Arlington, and our other partners like THR and JPS. So we're working on this very rapidly in trying to get to multiple days being addressed at the same time. So efforts in other counties, as you can see on registrations, of course, Tarrant County takes about 70% of the registrations that are happening. There are some unidentified counties at this point, about 8.4%, and I think that was a remnant from when we didn't have other counties open. It was just Tarrant County, and then people just registered with no county identified. And we're slowly working on cleaning that up, matching zip codes with cities to identify which county they're going to fall under. So that number is going to continue to go down to the empty field. But other than Tarrant, you'd be interested to know that about 5% of the people registering with us are from Dallas County. So
Pull them down and send them to Dallas.
Yes, sir. And then Johnson County, of course, and then Collin County, Denton County. So several other neighboring counties, as you can see, are registering. We've had people register as far away as Harris County. And then what was interesting was we got a call. Somebody wanted to fly in from Mexico. And we told them, no need. You can probably get vaccinated in your own country. But there's interest in Tarrant County from all over the place. So people are trying to get here. And then, of course, number of appointments being given. Tarrant County, of course, has the most appointments. Almost 79% are Tarrant County residents. And then several others, Johnson County, Dallas, Collin, Parker, Denton, all have had some people go through that have had appointments. Now, just to be clear, these are not necessarily that they were residents there and just wanted to come here. A lot of our county, city, government staff, other workers that work in doctor's offices do live in these counties as well. So that's why you're seeing numbers from all over the place. So genuinely, of course, they had a need to get vaccinated here while we started faster. So that's kind of the breakdown on where we are with those efforts. And now a more clear picture is emerging because we're finally getting some back-end data from DSHS. It is still about a week lagging. So the data that I have is mostly till 11th of January. And to fill the gaps, we have added our data. So we're as current as the 18th, but the last week has only information from public health, but rest everything is more complete. So it shows you a better picture. Last week I showed you Fort Worth had 45% coverage of vaccine and Arlington had only 6% because that's what we were seeing in our data. But as you know, Arlington's been doing their own vaccinations and reporting to DSHS separately. So when you actually look at the entire consolidated data set, Arlington's at 15%, which is good. It's closer to what their population, I think is about 15 to 20% of the county. So it's closer to where they need to be. And so those are...
So does this include assisted living?
I believe so, yes, sir. Yes, sir. It has the DSHS data set from their immunization registry, so everybody should be in there. But it's delayed by a week, so anything that is reported up to January 11th is in their data set. That's what they provided us, and supposed to be complete, but we'll continue to work on it. So that's the top 10 cities. And on the right, you can see different age groups. They're broken by 10-year age groups, which gets a little fuzzy to see. But overall, the bottom chart shows you that over 65 are about 31% of the total, and that number is growing. Under 65 are still making a majority because, like I explained, there are several people with underlying health conditions that are younger. Healthcare workers generally tend to be in that younger age group. First responders tend to be in that younger age group. So you're going to have a little bit of that front loading of that younger age group. And then as we work through 1B, you're going to see the numbers start to shift. So, okay. So again, our outreach efforts are on the rise, and so are registrations. But now that the numbers are getting large, to move the percentages is going to take a larger effort. So registrations are still predominantly Caucasian, 77% registering are white, only 6% are black, which I think is still lower than the number of African American residents in our community. So we need to continue to ramp up efforts so we can get to at least somewhat of a level playing field. Asian registrations have increased 8%, so that's good news. From ethnicity standpoint, there has been some improvement on Hispanic and Latino registrations of about 12%. But of course, in our community, I think the numbers are probably close to 30%. So there's work that needing to be done in every community that we need to make sure people have access to registration, they're registering, and then they're being seen. Here are the, again, efforts. So part of the issue, people have asked us, well, why does your process take longer? Because we do things very accurately and meticulously. So last time when I showed you, I had very good data, 91% this, 6% that, 3% that, the numbers added up to 100%. Now that we've got DSHS data, and this is all our providers, right? Doctors' offices, hospitals, everybody, start to look at the gaps. 52% unknown race, because people don't fill that out. So you are losing a lot on what is in the 52%. You can extrapolate that it's probably the same as what we're seeing, but an unknown is an unknown. So 38% white, 4% black, 4% Asian are people who have received vaccination. Similarly, on the ethnicity data, 57% is unknown. So 38% are not Latino or Hispanic, and 5%, which is very consistent with what we saw last time from our data, are Latino or Hispanic. So again, the point I raise is that when leadership like you makes the comments, please make sure that all our providers are aware that this is important, because it helps you make decisions on where to put the resources so that they can make sure that this is captured, because otherwise we're sort of flying blind with the unknown number there. Here's a more consolidated look of where the vaccination efforts have been concentrated. So this is, again, this is going to grow because, you know, it's kind of unfair to show it this way, because the denominator is all the residents in each zip code, but we know that they're not eligible right now. So where the work has focused in on is being shown here. A lot of these are communities, whether, you know, they were close to vaccination sites, or they had a high concentration of healthcare providers, first responders, and other things. So it's got a lot of factors on why certain communities are seeing more than others. It's not something that somebody said, well, let's just pick this community and you know, give them more vaccine. That's not how it's working. It's just organically sort of flowing that way because of how you know, the people registered and where they were in the categorization. But an important thing to note is that it's not just Tarrant County. Almost entire Metroplex has had some vaccination from providers within Tarrant County. So we could show even further out, but I asked the team to sort of limit to the major metro counties so you can see that we have given coverage to other partner communities as well. It's not just Tarrant County residents.
Now, Vinny, I mean, we talk about Dallas, but let's just, is there an effort to say to Denton, to say to the other hubs, okay, Dallas, if you've got X number of Tarrant County, let's switch. You know, let's give us your Tarrant County, we'll give you our Dallas County so that we can make it more convenient. And then you mentioned earlier that we can now pull down by county. I'm assuming we can also pull down by zip code.
Yes, sir, we can.
And so as you're giving THR their 8,000, are you making any attempts at giving them their zip codes around their different locations?
Yes, sir. So they've asked for it. I think the first batch we gave them was, here's all what we have. And then the second time around, they asked for specific zip codes. So we gave them a more concentrated, but we've given them a variety of things. Again, we needed clear direction from you all on how you want us to do this, because they have their community health needs assessment where they've identified priority zip codes. But that may translate into people getting mad. Hey, why did you focus in on that zip code? Because I was in line first, so I needed guidance from you, and I have my last slide asking for that guidance. So if you want to kind of hold that thought, and then let's discuss that in the end. But I wanted to kind of share this, that we have done, you know, as a county, and helped out other counties as well, and it's sort of happening the same way with other communities. To answer your question, yes, we can exchange information with different health departments, Denton or Dallas, but it's very hard to know why somebody who's a Dallas County resident registered here. It's not as simple. They may spend most of their time here working, and it may be more convenient for them to get it here versus going back home and the sites are you know, wrapping up or being done. And then they registered here because we opened here early, and now if we give them the list, they might get put back in the list. So there's a lot of things, you know, to kind of figure out. We will have the conversation, but we're just trying to be fair. If you register here, we'll take you. And it's happening where we give them a call and they've gone somewhere else too. So it's kind of all different ways. So here's the last slide on where we're seeking your guidance. First thing I wanted to show you is that it's hard to kind of see the red dots, but there's 4 locations. So there's the Northeast site in Hearst, there's the Arlington site, and then there's the Resource Connection and the Boland site. Those are existing sites that are working. And we sort of held off, but finally we've kind of divided the county back up into 3 zones so that we can feed, you know, people that are, you know, living in the areas that are closer to a site into a site that's close to their home. That is already happening as of this week. We were sort of dividing up by different zones so that people don't have to travel, let's say, from Lake Worth all the way down to Arlington just to get vaccinations, so we can clean that up. But the main point was, as you heard Dr. Trent Adams, there's several different ways to prioritize who gets vaccinated in a community. As we embark on that work and sort of lay out the master plan, there is a low-hanging fruit, like Commissioner Fick has said, is to address areas that have an active outbreak at the highest levels right now. Now, let me be clear. Our community as a whole has just, unmanageable numbers of an outbreak. It's really, really high. So anywhere you vaccinate, we're doing a good job. But even then, we've identified 10 high outbreak zip codes in our community, and those are my handy-dandy writing there, hopefully is clear. But those are the areas that, if you all agree with us, we would like to focus in some resources. And I'm not saying stop vaccinating others, but take a percentage, maybe half, do a half a day focused on people from these zip codes, and rest a half a day for the rest of the county as they're registered. But I want to be very clear, when we start prioritizing these people in these zip codes, you're going to have some unhappy folks saying, I registered first, and I work with a friend, and they live here, they got in, sooner than me. The answer is they're probably in that priority zip code. So I wanted you to be very clear and let us know if that's okay to do, or did you want to wait for us to finish that master plan with UNT on prioritizations. This is low-hanging fruit. It's part of DSHS directive to all vaccine providers. So we're on the right path. I just want to make sure you're okay with it.
My initial reaction would be that, as we've done since March with the testing, things are going to change every week, every day. Do what you think is best today. If tomorrow you decide that you think something else needs to be done, then tomorrow, go.
Yes, sir.
So right now, I'd say just do what you're, now one of the questions, and this would bring in more complaints, I'm sure, but I heard that there's certain counties where you can go to their website and you can find out exactly where you are in line. Now, the problem with that is if you go and find yourself in the line today here and tomorrow you're further down here, there's going to have to be the understanding that if somebody else registers and they have a higher priority than you, you're going to constantly be moving, one, because of vaccines given, two, because of prioritization standards in place at that time.
Yes, sir. And
but that's not going to stop them from calling in and just raising Cain.
So we have a partial solution built. The way it's supposed to work is, it's hard for us to predict on when you're going to get your appointment because there's too many variables, vaccine supply, multiple locations opening, multiple partners helping. You could speed up, you could slow down based on a variety of things. So what we are able to do is tell you whether you were registered, because that's a common question, and we see people registering 5, 6, 10 times sometimes because they just don't understand that they've registered. And second thing we can tell you is over the next couple of days, if you have an appointment, is it already assigned in the system. And once we activate that component, it will need a registration number, so we can send out en masse that here's your registration number, and put in your registration number and a date of birth so we got an exact match, because people mistype the numbers, and then it will tell you just that. It won't tell you when your appointment is, or like how many days far you're going to be, but if your appointment's in the next couple of days, you'll see that, or it will tell you that you're registered in the system and we're currently working on X date.
Will it tell, if they find that you've registered 5 times, will it immediately eliminate 4 of those and just give you the one?
So we worked on a couple of things. So we're currently deduplicating the database. I think we took out almost 30,000 duplicate registrations or triplicate, quadruplicate registrations on several people. And we've done all the matching, same address, same email, same name, registered multiple times. And we've built now logic into the system that if you have registered, then it won't allow you to re-register till a certain time goes by, like if your appointment has been missed or something of that sort. Then we've built some logic in there, and I forget how many days it waits before it kicks in, but to stop multiple registrations from happening, because it creates clutter. People get calls 2 or 3 times, and then they get confused. I got called to go to Hearst, now I'm getting called to go to Fort Worth. Where am I supposed to go? And it's hard to keep that straight if there's multiple registrations. So we're fixing all of that.
And What is this graphic trying to tell us?
So the idea is just to kind of seek your guidance that we have 3 zones. So there's 2 sites in this southwestern quadrant of the county. So at the Resource and Bob Bolin. And so these zip codes and these cities, because there's some of them are out of county, we would like to send people to Resource Connection or the Bob Bolin if they're appropriate for Bob Bolin. And then on the right hand, on the southeast corner of the county, those zip codes will feed into the Arlington location. And the top half of the Metroplex, so to speak, that would feed into the Hearst location. Because they all ask, like, people are going very far away. Can you do some logic on where they're getting closer to their home? So
And
that's step 1.
These red numbers, what do they represent?
They are the top 10 zip codes with the highest outbreak right now in our community. So that's what I was hoping that you're okay with, so that we can prioritize these zip codes, because that's where the most disease activity is in our community.
That's the hotspots.
Those are hotspots.
As determined by what?
By their case rate happening in the community over the last 30 days. How many cases have occurred per 100,000 population?
So for instance, 76104 and 76119 are not seen as hotspots, though anecdotally, they certainly are hotspots.
They have been hotspots in the past. Now, you know, let me rephrase. The entire county is a hotspot. So if you look on a relative basis, the entire, you could stick a pin anywhere and we're doing okay. You know, but even within the county, we have spots that are just so high. I mean, those case rates are unimaginable in those communities. And that's how I wanted to bring that up. If the direction is that at least let's start with the low-hanging fruit, that's an easy decision today. We could start programming them as early as later this week.
I just want to be comfortable that 76104 and 76119 are not hotspots because we're not testing at the same rate in those communities.
No, sir.
as we are
They're
now.
not in the top 10. So we're testing.
Say that again?
They're not in the top 10 in our community right now.
Okay.
They have been in the past, but the outbreak sort of ebbs and flows in different parts of the community. So there were community sections of our county that were spared, and now they're a hotspot of activity. And as you can see, there are some areas, you know, you are familiar with those areas, you know, where people have not followed guidance. And so now they're paying the price for not having followed guidance. Not everything, but there are certain sections in our community as well.
Okay.
Yes, sir.
So then I want to make sure that I understand that the thought is to prioritize these zip codes of current registrants, but that doesn't necessarily, and we would still keep these same zones and to coordinate where the locations are, but not necessarily to stand up additional efforts right now in these hotspot
So
areas, right?
this can be used to determine where the next resources are. I know y'all are familiar with an additional site that we were looking at in Fort Worth. And if that site, you know, gets stood up in the next week or two, we would actually redraw the map to make 4 sections to align. That way it's balanced. But I think I spoke with Mr. Manius earlier this morning that obviously we've got a lot of activity in the northwest part of the county, and there's not a site out there at this point. The nearest funneling site would be Hearst, which is, you know, we're a big county. So the need is obvious, you know, from a disease activity standpoint, and then just the workload standpoint. Yes, Hearst is a mega center, they can take a lot of volume, but this is a huge swath of land and a lot of people that we're having to cover. So to me, it's an obvious area that we need to, you know, look for other locations and find the resources for.
Sure. Well, I'm looking at that number 10 spot, have had recent conversations with Mayor Evans from Mansfield about a location that would serve not just Tarrant, but also Johnson and Ellis as well. So just mentioning they're willing to have the conversations to work on that once we get to that point. So.
Sure. Any other questions?
Do we have the capabilities yet of when somebody does get a shot and they've registered with you, that they could come in and tell you that they've got the shot and be taken out of the process? Our no-show rate is still running, what, 20% plus?
Yes, sir, about 20%. So we don't at this point. We're working on possible solutions for that. We're trying some things on site. It's hard for us to open the database up so much because the risk is that people are going to cancel out appointments for somebody else by accident because they mistyped something. So we're working through that. That's on our list of things to figure out, but we haven't found a good solution yet.
When you send out the ID number, well, that's still, people can still
So that's why we're
transpose
trying
or
to
do
add
that.
other things other than ID number, because that was the first idea. Give them an ID number, they can cancel it. But now we're starting to add other things. Well, I need ID number and a date of birth, or ID number and a zip code, something to make it more,
Unique.
Unique. Yes, sir.
As far as we know, you talked about 60,000 and that. Do you feel like overall in the county that we've probably given out over 100,000 vaccines?
Yes, sir, close to 100,000. That's very possible. And the reason I keep basing that on is we know we've done within public health and with Arlington over 44,000 doses, and us combined is showing us 21,000 on DSHS dashboard. So they're running about at least a week behind, if not more. And I know that we gave out 22,000 in the last week, so once that data catches up.
Do you feel like that our total registration, you said it's is it close to 300,000 now?
350,000, yes, sir.
And then when you look at 1A and 1B, and you look at our total world here in Tarrant County, are we talking about north of 600,000?
I'll ballpark, yes, sir, because about 1B alone, our estimates based on census information was about 500,000. So yes, probably another 100,000 in 1A, because there's first responders, there's doctors, hospital workers, and so forth.
Thank you.
Yes, sir.
So Vinny, a couple of questions. I think you had mentioned last week, were you done? I'm sorry.
Yeah.
Okay. Last week that we were working on our own dashboard for the vaccine. Can you talk a little bit about our progress on that?
So now that we have access to data from DSHS, that conversation had happened all weekend. We're working on putting it all in maps. So yesterday I had a whole different set of maps that we looked at and we're like, oh, that doesn't make sense because it looks totally different than what we expected. So we're working through several iterations, and once we have those ready, we'll work with Mr. Manius' office to make sure everything's the way we want to present. And then we'll try to release that so that public can start viewing, partners can start viewing. Questions are coming at all hours. I mean, not just from you, but a lot of other folks. Yes, ma'am.
I've got more questions.
Yes, ma'am.
No one's surprised there. So what's our sense of the number of people who are registering via phone versus online right now?
I'll ask for that, but
Okay.
majority is happening online. So phone registrations have their own challenges. So people are using them, and we're registering people. People are using the language translation. But the issue is, again, capacity there. And I know we're working with the administrator's office to find a solution for the call center. But the volume has just been too high, and there's been hold times that are just not acceptable, but we have limited resources, so that's reality.
Okay. What update can you give on access for veterans and the vaccine? My understanding of like what is or is not happening at the VA, and honestly, I'm kind of confused right now. What's your understanding?
My understanding is that they're supposed to get federal help on the vaccine.
Okay.
Now, they're welcome to register with us, and we will be happy to take care of them. The challenge that we've been up against with a lot of these entities is that people, when they register as a person. So I'm Vinny@gmail.com. And it's hard for us to figure out why Vinny@gmail.com is a priority. And they forget to put, or sometimes don't put the information in that I work at the VA or work for such and such entity that makes me priority. So that's been the challenge. So when you register as the general person, you're going to be along with the general public in 1B. But if there's anything else that qualifies you for a faster track, please identify that. It helps us look in the data. Oh, you're so-and-so city employee working for a fire department or working for police. And sometimes that information's been missing.
I've got one more thing for you. Let's see. 1 second, sorry. Actually, you covered it in your presentation, but I want to make sure I understood. If we go back to the bar chart where it shows where the date that people signed up, and so right now, we are working through the signups that occurred on the 1st, right? Did I understand that correctly?
Yes, ma'am. So the first is sort of where most of our effort is right now, but as you can see, there are people on the 2nd, 3rd, 4th, 5th, and all the way to the 10th, and even beyond, have received appointments. And the numbers start to get thinner. That is truly 1A people that registered on those dates. And then as you sort of work your way backwards, you can see almost half the bar is done. That's mostly 1B people and 1A people. But we're working on those days like very, significantly, like most of the appointments being issued are for people who registered on 1st of January or 2nd of January. And some of that split's now happening because people who registered on a certain date might fall to like Hearst, which has more capacity. Others may fall to a different area that has a little bit less capacity. So it's kind of working hand in hand. So it's not like we're just taking one day and saying we're only going to focus on this day. If there are eligible registrants on another day and they fall closer and the capacity's there, we're taking them as well.
Okay, very good. Because we've gotten a number of questions kind of along those same lines with, I've got a friend or a family member who did on this date and they've already got their appointment. I'm still waiting on mine okay.
There is not one answer that is right in this thing, so I just want you all to be very clear.
Okay.
No matter what we do, there's always going to be something that doesn't work right.
Very good.
Just a general comment, and this is to GK.
Yes, sir.
We've had a lot of discussions about call center. We need a call center not only for vaccination purposes, but we need a call center for COVID services in general. We need a call center that will cover rental assistance and economic assistance to businesses. We need a call center that is large enough to handle the whole range of activities that we need to be pushing out to the public. Vaccination is our priority, but we also need a call center that addresses these other issues as well, and we don't need more than one call center. We need one big enough and robust enough to handle all of these things. Select one from column A and
211 might be, if we can get the state to encourage their call center in Harris County, which is the statewide call center for all intents and purposes now. And we could talk with Kristen later, but I'm wondering how much 211's calls are centered around rental assistance and things like that already. My sense is from some of our Monday morning calls that a lot of that's coming in.
Well,
Yeah,
I know
and I
from
haven't seen
talking
the
with
latest
Kristen
report,
this morning that her office is being overwhelmed with calls. And there needs to be some way to handle those.
I do have one more question for you, Vinny. I've received a lot of concern about the availability of the second round for those who've already received their first round. Will you speak to that?
So currently we have 3,000 doses, I believe, that arrived for the second shots. This week we have about 725 people that are coming due from the shots that we gave. Now, there have been instances where people registered with us, then got their first shot elsewhere, and then they got a call from us and then showed up saying, I'm here for my second shot. So if they're eligible, we're trying to work them in, even though we didn't give them their first shot. But that presents its own challenge because we have limited number of doses that are tagged for that. We've sought guidance from the state, and I think we're all sort of feeling this out on what happens if there's an onslaught of people. So far we're not saying no. But it's going to be a challenge to continue to manage that. But we are working on, and people are getting, so the first 100 doses that we gave on the 23rd that you saw us give in Arlington, they're due tomorrow for their second dose. And Arlington location, we're not running like now the public health clinic, so we're inviting all of them to the Hearst Mega Center in the northeast part of the county. But there are already partners that can't send people there, so we're accommodating them at a different site as well. So we're working every different way we can to help out so that people have access to their second dose.
Very good. Thank you.
All right, thank you.
We have 4 audience participations. We're going to start with the calls. First call will be to Jonathan Gordon. I know I butchered that one, but that's okay.
Hello?
Jonathan, this is Judge Whitley. We are at the point on our agenda for audience participation. You asked to speak. You have 3 minutes.
Yes, thank you, Judge. Hello, all. My name is Jonathan Guadian. I am a resident of the 76119 zip code. As of late, I have been canvassing my neighborhood to gather community support for a project that my neighborhood association and I are working on. Through my canvassing, I often speak with some of the older people living in my neighborhood. Out of concern for their well-being, I ask them if they have made any arrangements to be given the COVID-19 vaccine. I have not met a single senior person in my predominantly black and brown neighborhood who has said yes. When I ask them why, the answer is always the same. They do not know how to register for the vaccination. Some of them have even stated that they didn't even know that the vaccinations have already started in Tarrant County. These incidents resonate with what Commissioner Brooks has been fighting for the past 3 weeks now. There is an incredible need for an increase in outreach efforts for COVID-19 vaccination within our hard-to-reach neighborhoods. Evidently, the rate of vaccines given to senior Latinos has been 5%, and the rate of vaccines given to senior black people has been 3%. This is unacceptable and not surprising given the priorities of some of the Commissioner's Court leadership. Apparently, a mega vaccination clinic was recently opened in Hearst to assist our neighboring counties, which of course is a noble endeavor. However, many of us in your black and brown communities can't help but wonder where, if ever, is that efforts when it comes to our neighborhoods. Instead, we are given terribly disproportionate COVID-19 vaccination rates, a COVID-19 informational website that is not translated in languages pertaining to our neighborhoods, hour-long call center waits, racist policies that criminalize us, such as 287G, and even lack of access to financial assistance to undocumented patients at JPS. The black and brown communities of Tarrant County demand the following: increased COVID-19 vaccination outreach for neighborhoods in Tarrant County that are predominantly black, Latino, or other hard-to-reach communities, increased staffing for COVID-19 vaccination call centers for Spanish, Vietnamese, and other languages pertinent to Tarrant County communities, increased staffing for COVID-19 vaccination sites to assist community members in completing required documentation, increased translations on Tarrant County's COVID-19 vaccination online resources into languages pertaining to Tarrant County hard-to-reach communities, create a plan of action for those who do not have access to electronic communication, and finally, placing information in other languages in grocery stores, pharmacies, food banks, hospitals, health clinics, and place information on television and radio stations that are frequently used by black and brown households in Tarrant County. Thank you.
Thank you, sir. Have a good day.
You too.
Next will be Joanne Cardoza. Joanna, this is Judge Whitley. We're at the point in our agenda for audience participation, and you had indicated that you wish to speak and address the court. So you have 3 minutes.
Yes, sir. Good morning, Judge Whitley and County Commissioners. My name is Joanna Cardoza, and I live in Precinct 2, the city of Arlington, which unfortunately has the second highest death count in Tarrant County. The same city that has leadership that cares more about bringing super spreader events than its citizens' health. 3 members of the city leadership has had COVID in the last month, probably from being in close proximity to others in their city suite at these super spreader events. I would like to start off with a quote from Martin Luther King Jr. Our lives begin to end the day we become silent about things that matter. Once again, the most vulnerable in our community are the ones being left behind, left to suffer from the effects of COVID due to the lack of access to health care, suffer due to the death of loved ones from COVID, and now that there is a vaccine, there is a lack of information, a lack of access to sign up for the vaccine, especially in communities of color. 1,904 deaths in Tarrant County, over 197,000 positive cases, each number with a human soul behind it. 21% of the deaths in Tarrant County have been from the Latino community. My Latino community has also been hit very hard in Arlington. COVID has only exposed what many in my community already knew, that communities of color and the undocumented do not have easy access to health care, especially in Arlington and Tarrant County. Some of you on the court and the JPS Board of Directors need to be held accountable. You have allowed your personal beliefs and politics to play a role in the deaths of some of this in the county. JPS is the only public hospital in Texas that does not serve the undocumented community, therefore taking access to health care away from taxpayers and whom are being ravaged by COVID. So no, Commissioner Fix, JPS would probably not be an equitable solution. My community needs the vaccine, and we need you on the court to partner with those that have a proven history of working already in communities of color, such as churches, nonprofits, community centers. All those cities have the capability to do mass vaccination efforts. They have no clue on how to work in or with communities of color. We have never been a priority for them. Give the vaccine to those organizations that can truly vaccinate the community in an equitable manner. My community needs a vaccination location that they can easily get to. Unfortunately, Arlington has no citywide transportation options, and don't let them fool you with VIA. I tried to set up an account and was not successful. My community does not have access to a device or internet needs. We need another way to sign up for the vaccine. We need information and a sign-up process in multiple languages. I listened to Vinny last week, and it appears that those being vaccinated are those that signed up back on January 1st. Every day, my community continues to fall more and more behind on the vaccination line. I hear our county judge boast once in a while about how Tarrant County is better than others. Well, right now, the county is failing the most vulnerable in our community. Thank you.
Thank you. Have a good day, Joanna. Next is Diane Wood.
Hello?
Diane, this is Judge Whitley, and we're at the point on our agenda for audience participation. You had indicated that you wish to address the court on the COVID vaccine item, so you have 3 minutes.
Yes. I have one big question. Are undocumented persons who live in our community in Tarrant County, are they eligible to receive the vaccine? I understand from the state that there is a law that says that anyone is eligible, who no matter where they reside. So I need the answer to that question. One event for me that actually prompted me to call is that I've been in contact with a person who is Hispanic. She's older. She's 66 years old. And I visited her at the request of a friend. I'm a retired registered nurse. And she does not speak English. Can you hear me?
Yes, ma'am.
she does not speak English, and she doesn't get out much. So I asked her if she had gotten the vaccine. She said she didn't know anything about it at all. So that's one reason for my question, because as you all know, through all your massive education, we cannot ever leave out any segment of the population. And someone mentioned, I think a UNT person mentioned, that there's a lot of distrust and there's a lot of fear.
She should go ahead and go in and register in the...
She's afraid. My point is she's afraid, and so many of our undocumented persons are afraid, because John Peter Smith does not provide them any medical care at all except for emergencies. And they know that, and they're afraid that if they go in, that they will, somehow be picked up and deported. So I address that to all the very intelligent people who have spoken today, and I'm sure that will be addressed. So she's not going to go unless I tell her that it's okay. And I'm not going to tell her unless I'm sure that she's not going to be placed on a list to be deported.
If she will register, and when she is called, she'll be sent to a location to receive the vaccine, and there should not be any questions. Vinny is not in the room right now, but
it doesn't require to register. Doesn't require a social security number, and then also you do have to provide a picture ID, but it doesn't have to be a government issued picture ID.
Well, if they have to have a social security number, a lot of people who are undocumented don't have social security numbers.
They do not have to have a social security number.
Yeah, I'm sorry if you didn't hear me correctly, Ms. Wood.
I'm sorry.
It does not require a social security number.
Okay.
And
so
they do not
the other
question.
point I want to make is that this needs to be advertised on television. It needs to be included in all the massive communications and media that's being planned. Undocumented people need to know because they are scared, okay? And these are people, as you know, who are frontline workers. They work all over the county in all kinds of places.
Thank you, Ms.
Wood.
Wood. Your time, and what I would say is we talked today, and that's part of the effort that we're asking, that we talked with the Health Science Center today about doing and utilizing, is not only the increase in the number of vaccines that we can do on a daily basis, but also how we give them, and also how we communicate to folks who have language issues, who have technology issues, and trying to get that word out. So we appreciate your comments.
I think that Commissioner Brooks best expressed it earlier when he said each individual in Tarrant County, not each citizen.
Each resident. And when you register for the shot, they don't ask the question about documentary status.
Yeah, so please encourage her to register. Thank you very much, Ms. Woods. Have a good day. Okay, next is Robert Bucher. I believe he's here, so he'll be coming in from the other room.
My name is Robert Bucher. According to the Fortune magazine, nearly 100,000 establishments that temporarily shut down due to the pandemic are now out of business. Don't worry, the billionaire tech companies love the lockdowns. I, again, keep continuing to find more and more evidence of the hypocrisy going on around here. I just don't understand it. You push for the vaccine, but keep forgetting about the people that lost all their livelihoods and everything. What's surprising about this one, all these kids in here, and not one mask, daggone. And then, of course, the fearless leader, once again, down there in Austin, having a good old time with no mask on. Mask for thee, but not for me. And local leaders, just locals. And all this is throughout the pandemic. I mean, I can keep going. Dr. Yonic's in there. I mean, there's doctors in here. Rick Marnes is in here. I mean, there's plenty. Best man doing, no mask. I mean, you know, if you're gonna take a picture, take it with the mask on to keep the spread down. I mean, I can just keep on and keep on and keep on. Now the CDC is saying people without COVID-19 symptoms do not need to be testing, according to the New York Times, which is a mainstream media big tycoon. And then there's more evidence, no mask at all. I mean, it's political BS. So King County has seen a sharp rise in fatal overdoses in the last 2 weeks. 17 that involve methamphetamine, likely involved in fentanyl. 45% of the fatal overdoses are among females, which is higher than usual. Seattle and King County officials have said there's been a sharp rise as well. Since December the 27th to January the 9th, 2021, 42 suspected. So people are killing themselves because they can't afford to live, they can't afford to do anything, they can't afford car payments, they can't afford houses, the homeless has gone up, domestics has gone up by 40%. I see them come through all the time because they cannot get away from their spouse. If I go to work with the mask on, I'm scared to get sick, so I'm just gonna stay home. That's what I hear from all the time. So why are we at 40%? We want recidivism to go down, but we got domestics going up, overdoses going up. I mean, how do y'all battle that? No, let's worry about the vaccine. We'll put them to the side. We'll worry about them later. Let us deal with them. And the other question that I want to know is, why are we the main source of taking care of the COVID patients? If we got somebody comes in and says, hey, I've had the COVID, we send them back outside. They go to MedStar. MedStar takes their vitals. Their vitals are not abnormal. Guess what? They come back in. They don't test them. They don't take them to JPS. We got to deal with them. We don't have the medical for it. We don't have medical at all. We're just a holdover. So then we take them over to Tarrant County. So you got 3 different people exposed: the officer, to us, the people inside the jail, and then straight over to Tarrant County. How do we change that? That's a spreader. And that's a spreading problem right there, because they have a ward that's straight for quarantine over there at Tarrant County. We don't have that. So guess what? We spread it, we take it out, and we do it. So, I mean, there's not everything's being thought about. So how do we get the sheriff's officers and the police officers to do that? How do we do that? It can't just be about the vaccine. It has to be about everything. Thank you.
Thank you, sir. And just as a reminder, next week, if you wish to speak, it needs to be in by 10.
Okay. I appreciate it.
With that, we're going to take a 5-minute recess.
We can go back to the administrator section. And I want to talk just very quickly about item number 2. Since Guidehouse is no longer with us, we're going to begin to get briefings, a more consistent briefing beginning next week. Just want to point out 2 things. This sheet this report, monthly or weekly report that each of you get, I don't believe you have it in your folder, so don't look for it. We will be sending that out, and it'll be more up to date. We'll send it out either later today or first thing in the morning to you. The only other thing, and really 2 things, is that I just want to talk about the testing sites. We still are doing a lot of testing, and this past week, even though we had some closures, we tested over 21,000 at our sites and our sites with our partners. And then finally, I know that we're briefing the court individually as it relates to the rental assistance. But we received a word this morning that $24,281,300 was deposited into the county's account today for rental assistance. That's not something that needs to be spent just during this fiscal year. It all rolls in to the CDBG type structure, and you all have been briefed on the qualifications of a person who can actually apply for that, and we'll be briefing you as we go through. But we do have money now from the federal government. It was a direct deposit in the amount of a little over $24 million.
Wait, will you read that figure again?
Yes, ma'am. It is $24,281,300.40.
Is that additional dollars?
That is money from the new piece of legislation that the federal government passed.
Okay. The new bill.
Yes, sir.
Okay.
So, and with that, we're going to move away from discussion on COVID. We're going to go to items number 3 and 4, which are legislative-related items, and Mr. Schaffner is here to address the court at this time.
Good afternoon, Judge, Commissioners. We're here today to request the Commissioners Court approval of amendments to the Commissioners Court legislative policy statements regarding community needs. These two items regarding public health issues that we requested and discussed last week, and we're seeking your approval.
Move approval, together 3 and 4.
You can do both 3 and 4 if you want to.
Move for approval of items 3 and 4.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes, sir.
Motion passes unanimously.
Thank you all very much.
Thank you.
Move to receive and file the personnel agenda.
Second.
We have a motion and a second to receive and file personnel agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning and good afternoon, and thank you. It'll take us back to morning, I think. So we have a few more items for you, actually 3 more items. All 3 items are waivers, a request for waivers for terminal benefits. The first request comes from Judge Westfall from the 371st District Court. She's requesting a waiver of 400 vacation hours effective February 1st. She has a court reporter who's leaving at the end of this month, January, with again 400 vacation hours. We're estimating the cost to the general fund to be approximately, I believe that's $29,100 and some change, and that does include fringe benefits.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The next waiver request comes from the auditor's office. Ms. Tidwell is requesting a waiver of 400 hours effective February 1st. Her information systems audit manager is leaving at the end of this month. We're estimating the net cost to the general fund to be approximately $23,600 and some change. That does include fringe benefits.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And the last waiver request comes from the district clerk's office. Mr. Wild is requesting actually 2 waivers, the details of which are outlined in your communique. One is effective January 25th. The other is effective January 30th. Replacements have been identified in both, for both positions. The combined request is to waive a total of 640 hours, 240 for one request, 400 for the other request. Sorry, new glasses. We're estimating the net cost to the general fund to be approximately $2,200 and some change. That does include fringe benefits.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. And if I could mention, Judge, just as a point of privilege, I was a classmate of Todd Dodge. He and I were classmates together at Thomas Jefferson High School in Port Arthur, Texas, and we did go to state my senior year.
Did he really?
Yeah, it was a fun time.
Very cool.
You gonna do Vinnie's?
Members of the court, we could go to public health on item F1. We're requesting that the court approve a participating professional provider agreement with Scott & White Health Plan for healthcare services at the Public Health Department.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
On item number 2, we're requesting that the court authorize the submission of a grant application to NACHO for the Evaluating Innovative Practices for Congenital Syphilis Prevention's cohort number 2 grant. This is an amount of $2,500 if awarded.
Move for approval.
Second.
A motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes. Yes.
Motion passes unanimously.
Thank you.
Thank you. Purchasing? Good morning.
Good morning, afternoon.
Yeah.
We have 6 additional items for your consideration. The first item is an award recommendation for bid number 2021-014, annual contract for power washing for facilities management, awarding to the primary, secondary, and alternate vendors listed in the court communique per unit price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The second item is an award recommendation regarding bid number 2021-015, Precinct 1 fuel canopy repairs for facilities management, awarding to KDA contractors an amount of $90,187.20. If approved, we're also requesting contract approval and acceptance of the payment bond.
Move approval with a clarification. This is for replacement of the fuel canopy, not for repair of it.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The third item is an award recommendation regarding RFP number 2021-028, offender defendant paid substance abuse outpatient treatment services for CSCD, awarding to Opportunities Counseling Center and Recovery Resource Council per contract terms.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fourth item is an award recommendation regarding bid number 2021-034, annual contract for mosquito control, pesticides, and products for public health, awarding to the primary, secondary, and alternate vendors listed in the court communication per unit price and discount from list price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
The fifth item is an award recommendation regarding bid number 2021-036, annual contract for AEDs, accessories, and bleed control kits countywide to the primary, secondary vendors listed in your court communique per unit price.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
And the
Yes.
Motion passes unanimously. Don't get ahead of me.
All right, sorry. Just anxious. Should have took my opportunity when Hyder was here.
Yeah.
The sixth and last item is an award recommendation regarding bid number 2021-044, annual contract for copier and fax supplies countywide to the primary, secondary, and alternate vendors listed in the court communique per unit price and discount from list price.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you. Mr. Skinner? Don't build the watch.
I'm sorry?
Don't build the watch.
Tell us what time it is, man.
Exactly. We're just requesting the Commissioners Court approval of the 2021 Transportation Bond Program policy. And, but if you do have any questions or comments, we're happy to take those.
I do have a few questions. In some of our discussions, we had talked about if there was a change in scope that would come before the court. I don't know that I saw that in the draft policy, so I could have missed it.
I believe that I believe it was included. I need to find what area that's in, but I do believe we included that in it. Okay, this is actually, thank you, it's actually on page 4.
Okay.
The I believe that's the second to last paragraph, about midway through, where it states that all scope changes, schedule extensions, funding modifications must come to the Commissioners Court.
Very good, so I did miss, okay, thank you. And then also, we had previously talked about receiving the bond council's timeline. Is there any update on that?
We do have a timeline. I simply didn't include it today. We'll bring it in next Tuesday, if that's okay. I'll tell you what we'll do. We'll go ahead and just simply email it to each of you.
Okay, great. And then on the third page, under the project eligibility criteria, the very last bullet says projects that have started prior to the date of the bond election are not eligible for funding. Sir, is that date of the bond election meaning the very date that it's on the ballot, or how does that work?
Commissioner, I just want to clarify, are you looking at is this the revised policy that?
Because it's not that projects are not included, it's the project costs incurred.
Yes, it's just a clarification that.
Oh, I am, okay.
We can't reimburse for the cost prior to.
The approval of the citizens.
Okay, I was looking at the old version. Okay, very good. Okay, I'm good.
Move approval. I second. Trent, I want to thank you for diligently moving this forward as quickly as you can. And GK, thank you and your staff. This is, I think, put together a good program. And I know I've talked to a number of cities in my area, and they're, I think we're going to have some good participation.
I think so too. And I'd also like to extend my thanks to Mike Delizio for helping quite a bit with this effort as well.
Mike we know he did all the hard work. He did all the prep.
Just a question before we vote on the transportation-related issues. Are we going to consider adding any issues that are not transportation-related to the bond program?
I would think so, yes.
Yeah, okay. Very possible.
So this here is simply the policy that we'll use for the transportation piece. And Commissioner Fickus, you're absolutely right. The transportation team did an excellent job on this policy.
Yeah. Very good. Thank you both.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Good job.
If I may just follow up, we'll work on the notification letters to the cities, and we'll begin that process right away.
Gotcha.
Thank you.
Thank you.
Commissioner Fickus, I think you have a
question. When do we need to appoint our the evaluation committee?
So, Randy, do you have a timeline on how we are going to proceed? I knew that you had put one together.
I think originally we had talked about that being in the March timeframe, and that will give us time to bring on a consultant to assist us, and we'll need those appointments at that time.
That's fine, thank you.
Thank you.
Yeah.
You ready?
Well, no, wait a minute. I want to, it just, when you asked me about that, when you mentioned that, Commissioner, that brought up something that I've thought about. And with TRTC right now, you know, Victor is now the executive director. Do we want to, how is the chairman of this committee picked?
Well, currently it's of course Mayor Williams.
No, that's TRTC. I'm saying if this advisory committee.
I'm sorry. I don't.
How did we do that?
I don't
Did
know.
we have a chair last time?
I wasn't a commissioner when y'all did that last time.
Did we have a chair?
I think the court appointed a chair.
I believe we did have a chair, and that was selected by the committee once it.
Okay.
And so I guess my question is, do we want to pick everybody, or do we, I mean, and then we pick a chair, or have the committee pick a chair, or do we want to appoint Victor as chair? think about it, and we don't have to, go ahead, I'm sorry.
I was going to say, I don't know why we would do it any different unless there's something I'm missing.
That was my understanding of how that was developed.
Now, we're also gonna have a consultant working with the group. Is that not correct?
Yes.
Okay.
We can think about that as we get closer to March, and
Sure.
and we may just decide to go ahead and do it as we've done in the past. Thank you. Commissioner Fickus.
Yes, have interlocal agreement. This is number 7K1, A and B with the city of Keller. Move for approval.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments?
No.
Then we'll move on. Are there any bonds that we need to approve?
No, there are not.
Okay, then we will move on to the claims, including the addendum.
Before we move to that.
Claims including the addendum.
Second.
We have a motion and second to approve the claims, including the addendum. Mr. Manius, do you have something?
No.
Is something going to go unpaid if we?
No, I'm sorry, I misread the
Russell
agenda.
doesn't get his check this week.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
We do have one final briefing item. It's just a standing item as it relates to the Texas legislature. Russell wants to address the court.
Thank you, Mr. Manius. Judge, Commissioners, per standard practice, we will have a briefing item on the agenda every week between now and the end of session until May 31st. We'll submit memos to the court regarding various salient items that may be happening during the past week of the legislature, and just wanted to address and see if we had any questions for this week. And if not, I'll go sit down.
Who are the 3 House members that showed up COVID positive?
I'm not for sure their names.
One was Representative Deschantel, though. I know that for sure. Based
Yeah,
off
that was announced publicly.
Yeah.
Okay.
All right. Thank you. Thank you all very much.
Thank you for the Senate committee appointments.
Yes, sir.
We'd appreciate the House committee appointments whenever they have been made.
We'll get those out to everybody whenever the House does select their committees.
Are you expecting that Friday?
No, sir. The committee assignments or the committee
I mean,
cards.
the following Friday.
The committee cards are due on Friday in the Speaker's office. It'll take a few weeks after that. So plan on late January, early February. By Valentine's
Day.
Day.
The following next Friday will be what, the 30th? So
It's going to move quickly.
you're thinking it's going to be the first Friday in February?
Late January or early February.
You ain't going to get any later than the 30th.
Understood. Thank you, sir.
Unless they're going to work on Saturday.
Thank you all.
That's all we have at this time, Your Honor.
Then we will recess our open meeting, proceed to close, discuss items exempt under section 5501.071, 072, 074, 076, and 087. There being no business to conduct at this time, we stand adjourned.